Thank you. And
Yeah, just
you don't
to,
need to read again, right?
will
We're
not. Just to
okay.
finish up,
Yes.
at the end, we, the Board of Carroll County Commissioners, further proclaim that in observance of Operation Green Light, Carroll Countyans display green lights in a window of their place of business residence from October 31st, 24 through November 11th, 2024, to honor all those who made immeasurable sacrifices to preserve our freedom, signed this day by all Carroll County Commissioners. Ms. Steckel.
Did it. Thank you very much, Commissioners, for the proclamation and also for the support that you give our veterans community here in Carroll County and beyond. I think the National Association of Counties really promotes the Operation Greenlight and encourages governments, local governments, to really light up their buildings to bring awareness, to let our veterans know that they're seen and they're heard and that they're appreciated. And I think that veterans in Carroll County know that because of the support that all of you encouraged to be provided through our programs and services here. I just talked to a veteran last evening at our job fair, and he said exactly that. He moved here from another county in Maryland and stated that when he came here, he couldn't believe the services that we had here for veterans because he did not see that same level of support in the county where he was from. And I just wanted to mention that because I think it's very important and very telling about how we show by our actions and our services how important veterans are here to us in Carroll County. I did want to have Bobby just share a little bit. We spoke in the proclamation nationally about the amount of federal health, disability, and compensation benefits, but I also wanted her to highlight the numbers we see here in Carroll alone with our Veteran Services Program and the funding we've been able to help veterans recoup for themselves.
Sure, absolutely. So since the inception of the program 10 years ago, we have been able to assist veterans recoup over $77 million in pension benefits and compensation claims. So with the hard work, Rick Pollard is here with me today. We employ 3 veteran service officers, and they are instrumental in assisting veterans in filing for those compensation and pension benefits and leading to VA health care. We're also very thankful to the commissioners for supporting those roles for the last 10 years. We have a coordinator of case management who also is so instrumental through the Collett Foundation, which we mentioned, Greg Collett earlier, helping veterans who are experiencing homelessness, link to resources and services, prevent veteran suicide, help with behavioral mental health issues, house those who are experiencing homelessness and have other emergency hardships and needs. This last month, it looks as though we submitted 23 new claims. We had 22 new representations. We make office appointments and also phone appointments, but also home visits. So we kind of meet veterans where they are. We operate the shuttle with a great partnership with Carroll Transit System to get veterans to their appointments free of charge with a caregiver if needed. And then each year, our lovely Victoria Parks is so instrumental in coordinating our veteran celebration, which was brought to, by Commissioner Weaver, 3 years ago that, we wanted to start this celebration. And so we've kept that moving along. Our Veterans Advisory Council, we meet every month with a group of wonderful individuals. Bob Eating here with us today as one of the VAC members. So there's just some tidbits about what we do here locally. I could talk a lot more, give a lot more circumstances, and talk more about our wonderful partners that we work with as well to support our veterans. So if you have any other questions.
I just want to say thank you for what you do. And, one of the things that I hear sometimes from veterans is that they don't always know the full range of what it is that we offer in this county to assist them. And so I want to give all of you credit in Victoria for being visible about it, because sometimes that green light or seeing that there's a veteran celebration is that physical reminder that you can actually see that there are these services, and it gets you in the door and it gets you to explore and to understand and to see the scope of what we have. And so I think that visibility between the veteran celebration, the green light, the proclamation, these sorts of things really do make a difference, and thank you for that.
And thank you, and it's great, and we've gone through some different periods of time. A lot of our Vietnam veterans didn't feel welcomed when they came home. And then it seems like today, and I know Commissioner Rothstein, you've talked about this some, it's hard to get some of the younger veterans to recognize that there's nothing wrong with getting involved and getting the help that's offered. And so it is a great communication effort to get that out, and thank you for doing that. And I do see some of the Vietnam veterans are starting to open up more, which again, and I think all of this helps that happen and makes them feel more comfortable. Roberta, did you pull it again?
I think this is the trick
So
for
let's-
Halloween.
Do we want to keep
Right.
talking? And
Yeah, right.
She'll let us know if there's an issue
yeah,
when she doesn't come back.
I'm just going to echo my colleagues' comments and appreciate all the hard work that you and everybody does involved. And obviously, Commissioner Kyler and I sit on the VAC as the ex officios, but truly appreciate all the hard work for all the veterans in our community.
Yeah, thank you for all your hard work. I appreciate it.
Thank you.
I also just wanted to note and give a plug to, we have at our local senior centers, we have recognitions for Veterans Day at Mount Airy on November 4th. There's a special luncheon and slideshow at Mount Airy during their lunch. If you call to make reservations, they can accept your reservations and you can attend that celebration. And then the rest of the celebrations are on November the 12th. One at North Carroll Senior Center, there's a catered lunch and a program. They're also kicking off their Toys for Tots program. At South Carroll Senior Center on the 12th, they have a private luncheon recognizing veterans and their family members, and that's a registration event, so please contact South Carroll if you want to attend there. And then Tawny Towns is also on November 12th, and they have a program in combination with their lunch to recognize the veterans as well. And the other piece, the celebration we mentioned, our big Veterans Celebration of Carroll County is on May the 4th. So trying to be creative with May the 4th be with you, with the veterans in that celebration. So if you have any ideas, let us know. But thank you very much for the recognition today.
and along with that, a few of the schools do some Veterans Day activities, and check them out. And I saw a list someplace, and I won't name anybody because I'm not sure I'll miss somebody, but there's several restaurants and businesses that will feed veterans free that day. So look around and take advantage of it. It's awesome.
It is. It's
Now,
amazing, the
Do we,
support that.
do we want a photo?
We would love one, as long as it doesn't trigger the alarm.
Where do we go?
You take your tags off.
Good to see you.
Centered, we good?
Not really.
Yeah, that works.
Keep balance.
Yeah, doing amongst the roses.
Yeah.
Thank you.
Thank you, guys. And so now I need a motion to recess our open session and go into their Board of Health meeting.
So moved.
Second.
Got a motion, a second. Any discussion, questions? All those in favor?
Aye.
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 And we do have on the agenda that there's public comment on this item, and I think we should, and, yeah, bring them on up. But public comment, we should go ahead and do prior to starting the Board of Health meeting. So do we have any cards? Do we have any callers?
I have no callers, sir.
Okay, thank you. Welcome, and
Yep, come on up. Well, maybe I'll start start at the beginning. Good morning, everybody. Now that we've all had our exercise, we can get into this. We're here today to do some presentations for the Board of Health. I believe we're going to start with the Environmental Health Bureau cost recovery adjustment, and we're going to go into the community health needs assessment and how that relates to the interactions between the hospital, the health department, and the community health issues at large. The youth risk behavior survey, which I believe I talked with Commissioner Kyler about a month ago, that it's being administered this year, but we finally have gotten the data from 2022, so we're going to share that. Our harm reduction efforts and our Health on Wheels mobile clinic. So to begin the agenda, we're going to start with the Environmental Health Bureau.
Okay, so good morning. I'm Lisa Staley. I'm the director for the Bureau of Environmental Health. So I wanted to talk to you today about increasing some of our fees for our services, the cost recovery adjustment. Several years ago, back in 2012, was the last time that any of our fees were increased. And then we are just kind of identifying some of the programs where we could do some increases and make the cost of the services for staffing and the actual fee gap close. So, moving forward. So some of the reasonings that we were looking at behind increasing these fees were to increase resources to complete some of our tasks more efficiently. Increasing requirements for there's been an increased requirement in a lot of our mandated programs. They're asking a lot more of us to do the routine inspections, the percolation tests, septic systems. There's a lot more training and technology and different techniques out there that we all have to learn, and lots of reporting that goes on with that as well. We also are looking at ways to potentially increase our resources for staff development, and again, that's taking them for trainings, increasing the technology, making the inspection process go a little bit faster, and as well as ensuring that we know all the proper techniques that are out there. And as I mentioned in the opening, the cost ratio between us to complete our tasks related to the programs where the fees already exist, the cost for our staff to do that in many cases outweigh what we're actually charging. So we're just kind of, again, looking at a way to close that gap up a little bit.
Whoops.
Whoa. Should I take the mouse away from you?
I'll use the
no,
little
I'm
arrow
kidding.
button from now on.
So just to recap, as you know, we're delegated our programs through Maryland Department of Health and Maryland Department of MDE through the Secretary's delegation down to local health. So just some of our mandated programs, and this isn't an entire list of them. We could go probably on for days of everything that we actually do. Percolation testing for subdivisions and individual lots, our septic permits, our well permits, our food service facilities, the inspections, the licensing, that includes temporary food service inspections as well as permitting, complaints, outbreak investigations would fall under that as well. We do the inspections for the trucks for our liquid waste haulers, also known as the septic trucks, the septic haulers. We do camp inspections throughout the county. We have a rabies and vector-borne disease group, so we do the investigations and we do complaints based off of those as well. We do review building permits that are sent to us by the county to ensure that they meet the proper setbacks, and if they're new homes, the bedrooms, or if they're doing additions, ensuring that their septics meet the potential for the number of bedrooms that they may or may not be adding. We do have air quality, where we issue open burning permits. We do complaints based off of those as well. Our pool inspection program, ensuring that people in the summertime and even some of the facilities throughout the year have safe swimming pools. We have our transient non-community water supply system and program, and we also do sewage overflows from public supplies. So with that, I'm going to go into how we kind of came across, I'm going to start with the Maryland Department of Health programs, which is where our food programs, food program and pool program would fall under. We when you look at this, we identified, again, the activities that needed to increase due to the time that we spend on them by not only doing the review, but actually conducting the task itself, the activity itself. The average cost to conduct includes both the clerical staff as well as the inspection staff to complete those duties. While the onus is always going to be on the inspector to ensure compliance with regulations, we do rely very heavily on our support staff as well to do all of the data entry, the permitting, sending correspondence, all of that nature as well. So I'm going to start off with food service facilities. So I think in the past we've talked about how they're broken down. So we have 3 different types. We have a high priority, a moderate priority, and a low priority. And basically the difference between them is the type of food handling that they do. So it starts at high priority is always going to be the most complex, and the chance for foodborne illness is going to be higher in those because they handle the food through different processes and different phases. And they also require 3 inspections per regulation each year. Our moderate priorities are essentially your cook to serve or cold hold to serve types of facilities. There's less food handling, and by regulation, they are required to be done 2 times a year. And our low priority are those facilities that would just sell potentially hazardous foods that are packaged, over-the-counter packaged. And they're done once every other year per regulation. So with that, to conduct 3 inspections on just one high-priority facility, it's roughly $581. And again, it's an average. Every facility kind of has their own niche. Some of them have higher processes that take longer to review on site. But essentially, we just looked at the average. We are currently charged $275, where we're looking to increase that fee to $375. And that, again, would be it's not going to completely close that gap, but it would definitely get us higher up to what it would cost us to conduct that activity. So the moderate priority facilities, on average, it costs us about $301 a year to conduct the activities just for the inspections alone. And we're currently charging $200, and we're looking to increase that fee to $250. Our low priority facilities, again, they're once every other year. Where just one is roughly $127 to do a routine inspection. We currently charge $75, and we're looking to increase that by $25 to $100. Our temporary food permit facilities, these are different. They are people that essentially would set up a tent outside. There's a lot of food safety controls that are affected by this. You're under a tent outside in the elements, generally on dirt surface or gravel, and they're doing a lot of cooking and handling where they don't have permanent hand washing facilities, permanent hot and cold running water. So the risk is a lot more higher on these than it would be in a restaurant that has more of a controlled environment. So just for one facility, one permit, it's roughly $55 in staffing costs for inspection and clerical to conduct the activity. Currently, we do charge $25, and we are asking to increase that fee to $50. And I just want to stress too with this is only for one inspector to go out and do an inspection for one food vendor. We have several activities throughout the county, throughout the entire year, that have 10 to 30 food vendors. The events get rather large, and we do have multiple inspectors that go out to conduct those inspections at those events. And that is just so because it's very limited time, and we have to be able to get through all of them. So if you would look at that, for example, an event with 20 vendors, we're probably looking at 3 to 4 inspectors to go out to conduct those inspections. So for our plan review, so we do plans for new and remodeled facilities, the ones that want to build, or they want to increase space or just do a general remodel. They take a lot of time. They take a lot of time to review, a lot of time to do research on the equipment to ensure that what they want to build, it's very important to get it right in the beginning versus going on the backside and trying to get it fixed while the facility's operational. So they're very meticulous to do. And there is lots of training that is involved in those. So we have an average cost to do those at $220. We currently only charge $100, and we're looking to increase that fee to $200. HACCP review, so the HACCP is the acronym for Hazard Analysis Critical Control Point Plan. And what that is it's a food safety plan, and it's to ensure that the operator in the facility knows how to handle the food properly and what they're going to do if there's a loss of a critical step, which could be if the temperature isn't adequate, what is it that they're supposed to do? A lot of the facilities as well have been trying to come up with more niche type of foods, different types of processes. There's been juicing, there's been people that want to do curing, dried meats. Those types of processes definitely take a lot more time for review and a lot more research to ensure that they're doing it properly. On average, it's $116 to review those. We currently charge $75. We're asking to go up to $100. So pool operator certification. The $5 fee has actually been in place since 1996. This has not been increased. Back in 1996, the volume was a lot less than what we are seeing now. So in the past, it was about 1 to 2 operators per pool. The number of pools have increased throughout the counties. We're also seeing that the staff there is a requirement for a certified pool operator to be on site at all times at these pools. And we're finding that they have more and more, so that if they always have somebody there. So if they don't, then the pool unfortunately does have to close. So in order for that not to happen, then the pools are actually having more people to come and get certified. So we're seeing an increase in about 5 to 6 operators come to us to get this required certification. And, excuse me, during the pool season, and we all know it's seasonal, and it's very short time. We're seeing that when they're coming in, there has to be a fast turnaround. And again, we don't want these pools to close because they don't have a operator on staff. So we try to turn those over rather quickly. There is a lot of processing and materials that are used, both to create that card as well as to ensure that they took the proper classes. So we are asking to increase that fee to $25, as the average cost is roughly $52 to complete. Okay. So we also looked at some of the activities that we don't do that we do in the Maryland Department of Health side that we currently don't have fees in place for. And we kind of looked at, okay, well, what is it that we could maybe add in? And so we're alterations to an approved food facility plan. So there's many times that after we've already approved the plan for them to go ahead and start, that they'll come back and say, okay, well, wait a minute, now I want to be able to change this layout, or, we really thought about it and this works better for us, or now we want to add this different piece of equipment. So that makes us have to then turn around and compare what they're wanting to propose as the changes to what was already approved. And so we're asking for a $100 fee to be in place for that. And again, that is just to conduct that review. The review is generally shorter. It's just that we do have to do that comparison, and there very well could be some research on if they're going to add equipment or what it is that they're going to be adding.
And just so I'm clear,
Yes.
these are fees that are not in place at all. These are new fees that you want to create?
Yes, sir.
Okay.
Yes. There's equipment-only review. So we have lots of operators that come to us and they say, you know, I want to add this walk-in, or I want to add this. So we ask them, you know, to provide specifications to ensure that it meets the proper certifications and standards. A lot of that new equipment, some of it we haven't seen before. Much of it we haven't. There is a review that is required for that, not only just on paper, but then we also have to go back and make sure, say they're going to add a walk-in refrigerator or freezer, then it requires a site visit to ensure that it was built accordingly and that the temperature is proper. So we're asking for a fee of $50 to be included for those reviews. The other thing, so we have had in the past a late fee for temporary food permit applications that weren't submitted within 14 days. We have not been charging that. We would like to start charging that, to start that back up. And I'm not sure why. I believe it stopped well before COVID. But we have many applications, temporary food applications, especially for these large events that literally, the event is on Saturday and the package shows up to our office on Wednesday. If you have one that has 20 vendors and that's Wednesday, that doesn't really give us an adequate amount of time to do a proper review. The approval process, many times we have to go back and continue to get additional paperwork or additional information from these operators to make sure that what it is that they want to do is going to be done safely. And also, it does create us that we have to drop what is being currently done to take the attention over to these applications to make sure that these individuals are able to actually operate on the day that they want to. So we would like to request that a $15 additional fee on top of the temporary food service fee be added in. And that is kind of in the hopes that that would encourage people to get things in on time so that nobody has to scramble at the last minute. And again, you know, there's been times where staff has to work after hours or just to ensure that these actually do get approved on time.
And Lisa's being very kind right now because we have multiple events, and Roberta knows this because I text her.
Yes.
Where we had to actually close vendors this year because they didn't produce any paperwork to us. And the day of the event, we tried to get the paperwork to go through, and they still couldn't produce everything we needed. So our goal is to, if anybody wants to be a vendor at an event, make sure we have the paperwork so that when we go to inspect that day, they can operate. We don't want to have to be texting Roberta to text all of you to say, oh, by the way, we're closing down 5 food vendors here because we didn't have the paperwork. And even at the last minute, they weren't able to produce everything we need to be able to say, yes, you're good to go. So they've been working exponentially to make sure that if they get something 3 days before an event, that they're getting through these vendors so that we can have Fall Fest and, you know, all the other different things that happen.
So how do you accommodate, for example, a food vendor who may be notified late and they decide at the last minute they want to be part of an event? I mean, do you take that into account that they're a last minute addition? Do you give them leniency because they were requested to participate at the last minute?
That's a great question. So we rely very heavily on the coordinator of these events because if it's a one vendor, one-off event, you know, they decided, you know what, I'm going to head and I want to do this. I want to set up over here for this fair. They didn't have anybody. So it's a one person. So they wouldn't necessarily have an event coordinator that would submit that package. So these large events, for example, at the Farm Museum, the coordinator at the Farm Museum is the one that's responsible for collecting all of that paperwork to ensuring that when they send that to us, that is all there, that is everybody that is included when they're to send us a submission. So it would basically be up to the coordinator at that point to cut it off, that this is what we've got.
So if,
Yes, sir.
sort of, I mean, if I'm a vendor and let's say there's really not a coordinator who is in charge of collating all that information, right? And, you know, I get contacted 2 days before an event, say, hey, you know, our burger guy pulled out, Joe, we want you to come in and set up a burger stand, right? In a situation like that, do you have the authority to exercise leniency given the very conditional nature of my showing up?
We would. We very well could. You know, there are going to be circumstances where that could take place. I mean, I had one recently, and it was a vendor that was kind of trying to go kind of behind the coordinator and trying to get me to approve that they can be in this event. And I said, this is not my event. This is the coordinator, and we would need to hear, you know, that they're actually, because if I approve them and they show up and the coordinator was like, you know, who are you? Because that makes, everything should be going through a coordinator for these large events. But if it's not a large event, then, you know, we could definitely have a conversation with them. And if it is a last minute call, I mean, we have
Always
people.
give them what they need to submit,
Yeah.
and that's what they did in this case with the 5 vendors who were there.
So-
We need this from you, and if you can
Right.
produce it, we can, you know, work this through, but they couldn't produce the information that we needed. And some things are critical to us approving. them.
But I believe what your question is that we've had people that they may have had a licensed food truck that has canceled on them literally 2 days before. And they're scrambling, just like you said. And yes, we would be able to
Yes. That's what I was gonna say.
create, you know, hear the situation and make a decision if we would waive that late fee or not.
I just wanted to make sure, because I certainly understand the safety aspect of it. I certainly understand wanting to have like a protocol in place, but I also want to make sure that we're not over-regulating ourselves into excluding people because of timing, so,
The very short answer to your question is yes.
thank you.
You're welcome.
So, quick question back to that previous slide, if you could, for a second. So, here we have the average cost to conduct, and you have proposed fees. Just curious, why haven't we charged fees for this in the past if it's costing the health department?
I can't speak on why they chose what they chose back in 2012 when we last increased fees.
I can share with you that we've been reviewing, and I had this conversation with Commissioner Kyler, all of our workflows and all of our processes and where we've made bad business decisions in the past. And we did that in another area of the health department where we were putting up $300,000 in staffing and resources for a contract that was paying us $76,000. And we have to go back and have those conversations. It's a business. We're providing a service. This is the cost it's costing us. And these are the things you're asking us to do, and this is what our cost is. So we've been going back, I guess, for the last year, I'd say,
Since I
through
started.
kind of all of our work processes. Part of that has been simplification of the process. So there's one form, you can put it in for multiple events. If you're gonna do something on 15 Fridays, and you're always gonna have your popcorn stand up on 15 Fridays, you can put it all in at once, correct? No?
You can put 15 applications. Well,
You're trying to
That's it,
simplify it, so we're
yes,
also
we are
trying
trying
to
to
make it.
simplify that based off of our conversation last spring.
And we would have to go through the state legislature to get that fixed about the application periods and process for temporary food. And that's something you're still willing to commit to having that change to make it easier on our citizens?
Yeah, we're willing to entertain any discussions that are gonna make it easier for Carroll Countyans to run their own businesses as well. But like you said, unfortunately, we're at the mercy of MDE and MDH and Comar and such that we also have to abide by the regulations they give, but we're always happy to entertain those conversations.
And we've been very clear that the agritourism regulations do not mirror the MDE regulations, which do not mirror the MDH regulations according to temporary events, you know, seasonal events and special events. And that's one of the things that we have exclusively asked for, is that if we could come up with one set of definitions that made sense, because that's what gets people confused. I'm here doing this temporary event, and I'm over here wanting to do a seasonal event. If I'm agritourism, I can do it for this period of time, but if I'm not agritourism, I can only do it for this period of time. And those kind of nuances are what make it very difficult for people to understand. That, you know, it's not an apple to an apple and it's apple to an orange.
Right, and I do want to add that probably about 5 years ago, the limit on the temporary food permits was only 14 days. And through legislation, that was actually able to be changed, and so therefore the regulations were updated to allow for the 30. There was a lot more involved in that piece of legislation, a lot more involved, but that actually was something that came out of that. So in order for the regulations to be changed, then they would be looking at legislation at the state level as well.
Thank you.
Yes.
On fees, Didn't the state increase some fees already this year? Or not in Carroll County? And what I heard about particularly, it was a bad year for pools, but you told about the operator, but something about the fee they had to pay was up to $100 to be inspected, to open for the season, and the other thing that happened is, like in Manchester, they have 3 pools, so they were charged for 1, now this year they're being charged for 3. And I know they were gonna talk to you about it, I don't know what happened then, but I thought that was all state mandated increases, but,
So what I believe you're referring to is the requirement to license each body of water. So each body of water that a facility has needs to have its own separate license. That's probably what it is that you're referring to.
a
In our-
swimming pool?
Yes,
Yeah, last year they didn't, this year they do.
yeah.
Yeah.
There was, we did a phase-in period when that
Okay.
requirement went into the regulations, so we did do a phase-in period
Okay,
for that as
gotcha.
well.
And that allows us to close one of the pools and not all of the pools. So some of you got emails when we were closing pools. Very bad year for pools this year.
Yes.
I think it was the hot summer, but the waiting pool got closed and not the other 2 pools got closed. So it does make it a little easier.
So it might be to their advantage to have 3 separate instead of
It
one.
absolutely is.
Gotcha.
So, right, if you, and again, like Sue said, if you just have one body of water at that facility with 1 license, then the entire facility would have to close versus just maybe the kiddie pool. So. Okay, so this is just a slide that just shows the previous chart and just the differences. So the current fees that we are collecting through the programs that we had identified, this isn't that we're proposing an increase or an addition of fees, is $129,350. The total average for those activities that we do for just our staff, and again, this doesn't account for travel time, fuel, any sort of supplies that it would take. This is just strictly the time it takes the staff to do those programs, is $352,031. If we're able to increase the fees to what we had proposed, the increase collected would be $247,815. The difference between the current fees collected and the average cost was roughly 36%. So like I said, we're just kind of looking to close that gap just a little bit more. Are there any questions on the MDH before I move to the MDE side? Any more questions? So, as mentioned, we're also delegated various Maryland Department of the Environment programs. So we looked through those programs to see, very similar to how we did with the MDH programs. So what we had identified were, to increase the fees, were these 4 different programs. So I'm going to come right back to that septic repair and evaluation. So the development review and percolation tests, this is just to do, this is a slight increase, and it's because we're finding that there's more time spent in the field to conduct the percolation tests for the new lots. And so, excuse me, and also that time also allows for us to do a little bit of moving while we're on site versus saying, okay, now you're going to have to go back to the surveyor, identify a new spot. We're able to actually do that on site now. Because there's things, that happen out there that might not have been identified on the plan for, you could have an intermittent stream that might not have been identified, and okay, now we have more of a setback area. And I do want to note that those percolation tests for the development review, 10% of those, what we collected, go into a fund that's the wastewater disposal fund. And what that is 10% of those. And what that is it's a fund that we have where low-income homes who may need assistance for upgrading their sewage disposal system to an innovative and alternative system, which can be quite costly, they could apply for some of those funds as assistance as well. So an increase in those fees will theoretically increase that fund as well. The subdivision review, and this is just for the review itself, we're looking to increase those fees slightly. It's not as much, but again, that's based off of lots. Trying to see. So the current fee covers 2 reviews, which is the initial review of the plan to conduct the percolation test, and then once they're done, and then the final plan that would come in after they have solidified the locations for the sewage disposal systems. The commercial site review, the current fee, same as the subdivision review, covers the 2 reviews, the initial, to which the review of the plan the review is done of the plan, and then that allows them to go out and actually do the percolation test. And then the same thing, the second review after the percolation test for the final plan approval. It also includes the design and with the commercial site plans, it also includes the design of the system as well. So as you can see, we're looking for the development review for the different types of systems. For a trench system, it's $200, costs roughly, and again, it's all on average because every lot's a little bit different, $278 to do, and we're looking for an increase to $225. For a sand mound system, excuse me, it's a $300 fee that we're currently charging, and same as the commercial system, and we're looking to increase those to $225. And as you can see, the sand mound system, there's an average cost of $336 and the commercial of $359. The subdivision for 3 lots or less, so if you get a plan with 3 lots or less, currently we're charging $100 for the review itself. And again, there's the 2 reviews, the initial and then the final. It's $162 as an average cost for us to review, and we're looking to increase that to $150. And then for any subdivision reviews for 4 lots or more, we were charging $100. That's the same, so the $100 is the same as the 3 lots or more, but there was an additional $25 for every lot that was over 3. So that's can get a little, so it's roughly about $104 for each lot over 3. So for each lot over 3, we're proposing the $50 for each lot over 3 versus what was $25. So same as for the commercial site review. The average cost for less than 2,000 gallons per day is $162, and we're looking to increase to $150. And the greater than 2,000 gallons per day was $301, and we're looking to increase to $250. So I wanted to kind of put the septic repair and evaluation on sort of at the end, because it's a little bit more. We used to have this application. During COVID, we actually waived this application, and I think it was just because the staffing was around, but we had charged $100. We're looking to maintain it at that, but we just want to resurrect it, and we want to bring it back. The other reason behind this is based off of the septic permitting process. So by separating this out, we're actually having the entire plan review part. When I say plan review, the review part of it, so the design, the perks, everything like that would go ahead of time. And then once that homeowner or the contractor is ready to move forward, because there's many times that we do all of that work and then nothing happens, then they would then apply for that septic permit. And so we would then just be able to move, after we go out and look at the site, move that permit right through that process. Which one? So these are, again, similar to the MDH. These are program These are activities that we do that we don't currently charge for. There's building permits, as I mentioned, there's lots of building permits that we get through the county, and many of which are on well and septic. These require, some require site visits because we may not have the records, or the records might not be accurate. They require research to find out where everything actually is on the property. So they do take time. So the average time to conduct these permits is, just for our office alone, is $52. So we're looking to propose a fee of $50. The test wells, we have a well fee now, a well permit fee now. However, we are not charging for test wells. And what we're finding is that these test wells, they go in, we're doing the work, we're doing the siting, we're doing, ensuring that they go in properly, but we're not actually charging a fee for that service. So we're looking to charge the $160 well fee for the test wells as well. And that $160 is capped in legislation, so we would not ever be able to go above that. We're finding more and more wells are being converted, either from, could be from a test well, could be from an agricultural well, but they're definitely being converted. That, again, we're not collecting the service for that, a fee for that service, and we're looking to propose a $50 fee for that service. The alternative and innovative system reviews, these, we have a lot of properties. The good soils in the county have been eaten up. Unfortunately, we're on to some of the not so great soils. So we're finding, especially through repairs, that there's a lot more alternative and innovative systems that are going in. And the time that it takes to do those reviews and to do those permits and those finals, just because of all the different steps and the different agencies that we have to coordinate to go through, we would like to propose a fee of specifically for those to $150. And they take, those two specifically take about the same time, about $220 to do those reviews to ensure that they meet the regulations. The septic permit transfers, a lot of times, a home might start with one contractor, but then, I'm decided that, well, we're gonna go ahead and move to this. But what they don't understand is it's not just about paperwork. We also have to ensure that we have to go back out with this new contractor. We have to do the site to make sure that they're aware that this is actually where it's supposed to go properly, that the plans that they're submitting, that they have them, and that they're the same ones that we previously approved. So again, we're looking to propose a fee for that of $50. So the liquid waste haulers, which is also known as the septic haulers, the septic trucks, we see them all around. We are one of the only counties that don't charge for those. And what we're finding is that everybody is coming to us because our service is free, and then they're taking their inspection to a neighboring county or another county in the state to get their actual permit to operate. So we would like to be included in that. And again, there is a lot of time. They come to us. In some cases, we go to them. We do inspections on the trucks to make sure that they're not going to discharge, cause any sort of public health as they're driving down the road. And we'd like to propose a $50 fee for those. There is a commercial site review of greater than 5,000 gallons a day. We don't generally see a whole lot of these, but when we do, it's very, like I said, that's very rare. But there's a lot of aspects that are involved in these permits. It takes time to do the scheduling, issuing the permit, coordinating with Maryland Department of the Environment, because they also have to go through them. And there's a lot of different parties that are involved in making sure that these are reviewed and approved and meet the applicable requirements. So on average, it's $359 to do the review on these, and we're looking to propose a fee of $300. And then we have the plats. The plat reviews, it's just a matter of just time for the reviews. There's correspondence that goes out in coordination with the other agencies, and it's just a matter of time. And yes, a plat review is simply just a paperwork review, but there's a lot of time that is involved in doing these. So it's an average of $81, and we're looking at a potentially $50 fee to be increased in those. So similar to the, same as the MDH programs, we did a fee comparison of what we're bringing in currently for the identified programs that we do under the MDE programs, and what it takes for us and what we're proposing. So it is actually very low for what the current fees that we are bringing in under the MDE programs for, again, just what we've identified. It's only $46,000. If it's an average of $141,139 for us to do those services, which is a huge gap. With the proposed fees, it would definitely close up that gap a lot more, as you can see in that chart. And this is just kind of just a slide so you can see everything all together. With both programs, we're collecting, with the programs that we've identified, we're collecting $167 roughly, and with the proposed fees, it would be $382,930 that we would bring in. And again, just to recap, that's so that we can continue to do these services, that we can provide, we're looking at methods to ease application processes, our time, cut back with different technologies, ensuring that, you know, the techniques, the training, making sure that everybody has the proper training to do these. Just generally increasing the resources for our staff to be able to conduct these.
And I think that concludes our presentation, but
Concludes
this was
that.
the only item that we had that we needed a decision on, because the Board of Health is who decides on whether or not we can raise our fees.
Did you have any sensing sessions or discussions with the community as you were
Excuse me.
looking at the fee adjustments?
No,
And then the second, I apologize, then the second is also, how does this compare to our neighboring counties?
that's a good question. So we didn't discuss with the community. Again, we just looked at our costs to be able to conduct the activities versus what it is that we're currently charging. That's how we came up with those numbers, and about roughly how many that we are doing each year. And our neighboring counties, they're all across the board. Every one of them is across the board. We're seeing $5 on the Western Shore to, and I'm just talking about on our side of the bridge, to, there's some counties that $150, $180 for just a one-day permit, those
Right.
types. So it was really hard to do a cost comparison for that with the neighboring counties. And what I can tell you is that there is a lot of counties that are proposing fee increases as well. The emails have been going around, you know, can I have your fee schedule? Everybody's looking to do this as well. But yes, it was really, like I said, it was very hard to do a cost comparison with the counties just because they're all over the place.
When I met with Commissioner Kyler, I shared that MDE has a bill prepared to go in, and because they have had, I think, one county right now turn their MDE programs back into the state, and the state's handling it. And that proposal is no more than $585 for a septic permit, I believe, because they can't collect fees right now, so they just gave a top fee. They didn't give the rest of the fees, but that was what they were trying to recoup. And so they are all over the place. They are based, some counties don't hire at the levels that we hire and where we train people. So they're actually make $20 more an hour than we do, so they're hiring more skilled staff than we are able to hire. So they recoup it in those fees. We've talked about this at the health officers' meetings, that everybody has fees all over the place, and it's based on the actual costs that it takes them to do the job, and then the grant funding that they get, and trying to make those two things come together to cover the cost for making sure that the community is safe and that we're able to have the proper resources.
You believe that the fee adjustments would not stifle growth or development from users? And then also, is there a concern that shortcuts could be taken because of fee adjustments? Like builders will say, well, I'm not going to deal with this, and I'm going to figure out a shortcut how to take it.
I don't see on the MDE side that it's stifle growth. A lot of the contractors, they're used to paying these fees, the higher fees in the higher counties. We have heard comments, oh, you guys are cheap, you know? I mean,
yeah.
heck, septic haulers, we're not charging, so everybody's coming to us and then they're going around.
Right.
But for the growth, for the land growth, I don't see that that's gonna stifle them at all.
Right.
On the MDH side, again, you know, we're trying to, I don't think so. I really don't, because it is actually the cost of doing business. And it's not a huge increase. I mean, we're talking a year, the highest would be a high priority facility, and it's $100.
Right.
The other thing about that is, you know, what they would have to understand too is that it would also assist us in ensuring that the staff can go to the proper training and have the proper tools to conduct their inspections, and maybe lessen the time that they're actually going to be in there, because if we can use technology more in the facilities, then we can get out of there faster.
And we are trying to automate our forms. We've met with the state. We're going to be able to use Cognito forms, which is going to allow people to go to our site to put in their applications and to make payment all at once if they want to use a credit card. And if not, and they want to stop by and pay cash or by
Check?
Yes.
that would be a credit card. They can stop by and they can complete that form online, and then we can just go in and say they've made the payment, and it'll go to our fiscal department, it'll go to our environmental health department, they'll do their piece with it. Our fiscal department will do their piece with it.
And the other thing, on the MDE side, we are actually implementing a GIS program. We have the sub-meters as well as tablets to go out into the field to be able to collect that data. So that's part of that as well, is that's a service that we're going to provide for people for building permits. And we're actually
Right.
going to work with the county as well to make sure that we all kind of are having it in one place. When they pull it, they know where their septic is, they know where their well is, they know where this stuff is. And it would make everybody's life a lot easier.
We have pulled files sometimes, and there's a piece of notebook paper in there with a line on it that says this is where the septic is, and I'm like, which way do you hold the paper? You know, like.
It's usually a circle with a line to a rectangle. What?
And so those are the ones we have to go out and we have to investigate where exactly everything is before we can move forward with work.
So,
Do you see the state coming out anything this session? Our governor has really pushed affordable housing and has said taxes won't go up, but fees are going crazy all over the state. MDE's increasing their requirements, which is going to cost. It's going to be very hard to have affordable housing. Do you see them coming up with any kind of sliding scale or discount if you're affordable, or?
you never know what's going to
Oh,
come.
I know. Maybe you did.
Never know. Well, what I can say is right now, the only fee in MDE that is capped is the well fee at $160. And as Sue shared, that they're looking to potentially propose increasing that fee for the septic permits for the programs that have given back their delegation, they've taken back over to 500 something, so,
Maybe something, yeah.
yes.
So did you mention the last time fees had actually been raised? Were you able to tell us what?
September of
2012.
2012, okay.
12 years.
And you had mentioned the website, and people have been able to go online. I noticed, is the Carroll County Health Department now using the state portal for people to get to information? You don't have your own,
The state hosts our
Yes.
website.
is that a relative new change?
Yes.
Yes.
And that, so we've been trying to alert people that the top of our screen where you see the Maryland flag, if you click on that, you will be diverted to the state. If you go to the blue underneath of that, then you're at the health department. We've been fine tuning it with the state. There's no way to get rid of their banner because they host our website. But the state's very good at if somebody puts a request in, like we had a request from a PTA member for prevention services to come out in January to present at a PTA meeting, of getting that information to us if they accidentally fill out the wrong form.
Okay.
It's not perfect, but we're,
Yeah, it's a,
We
I
were-
noticed
yeah,
that this
we were-
morning. Okay.
we were being charged an exorbitant amount of money by Do It. We got an invoice, and it should not have been what it costs to host a website for a year, so we made a decision that we were gonna move, and the most economical change was to use
Okay.
the state.
All right, I didn't spend too much time on it, but I noticed it was a little less intuitive in some ways, but definitely, not as pretty sparse on there as well, which I think is a benefit to people going online. There's not too much stuff.
It's
to
a lot
click on.
easier. They have the widgets where you
Yeah.
can just click on the individuals versus having to scroll through pages and pages.
Now, if you remember back in May when you were with us, I had specifically talked about the appeal process for MDH. And I'm looking on the website now, and I see some documents about how people can appeal, but I'm curious if that process has been updated since,
Well, the process
Last
is
May.
the state's process.
okay.
For MDH, for the food service facilities, it is, they write an appeal to the health officer. Anybody who does not agree with something that we've said has the right to reach out to me without making an appeal. They can just reach out to me, and there's been many instances where I've been able to say, either direct them to what the regulation states, and it's mostly about potable water. Is that the one with the wells that I get questions on? Because the test has to be done before you get a use and occupancy, and then the test has to be done again within 6 months. And some people wait beyond that 6-month period of time, and then they have to go back and do the first test again because the state law very well. So once I'm able to direct them, even though I'm sure they've heard that from our staff, but the state process goes through to have an independent person, which is the Office of Administrative Hearings.
So
Well, okay, but,
the
and
appeal
that's,
process, real quick, that's on our website is actually the one that was instead of having legislation, that was an agreement that was made on versus having the legislation come in. And that was actually agreed on by MDH and the delegate that was was with that.
so I'd like to, when I click on those documents on your website, I'd like there to be a date on those documents. There's no date, so it's hard to say whether they've been updated or not. And I think the board's aware of the fact that it could be any number of issues why people might be denied a permit or revoked a permit. But, just the very fact that I don't know if there's any discussion about administrative hearings on there, which would be the next step after an appeal process. So my concern still stands that if people go to your website, which is your website, they don't understand what the appeal process really is. I'd like to see a standardized letter as well that you're sending to people as to why something's being revoked or denied. And that should be a one easy use, one time, standard letter, one size fits all, where maybe you check the box that's revoked, you check the box that's denial, so you don't have to repeat the process again, and maybe even a flow chart process. Because again, you can see how quickly people might get confused if they don't understand the entire process itself. And let's hope there is an administrative hearing involved at some point, because that means that things have progressed even further down the road. We haven't been able to mitigate the issue here locally, which would be a shame. I mean, that's what we should be doing.
And since I've been here 3 years, I've not had anything go to administrative court.
Almost. I mean, we've had a couple almosts, but,
Had one that I'm aware of.
I'd like to see more on the website, once again. I mean, I talked about this last May. I'd like to see more in terms of, what are all the documents people can expect to see when they're appealing. I don't see that right now. I open the PDF, I don't see a date on it. So if people have the same issue, I think it's just going to come up again. Now, as far as the fees go, I understand why you're out coming to ask for increased fees. That seems to make sense to me. Everything's costing more and more money. So that part of this presentation I understand, but again, going back to last May, I would like to see more for people who might be getting involved in this process, particularly the appeal process. And if it's an issue of, well, we can't put that on our website because it's a state website, I hope that's not the case. You should have the authority and
Yes,
autonomy to
correct.
put anything on there you want. Okay,
We do.
all right,
Yeah,
thanks.
and I'm happy, I mean, I can work with MDH to make sure that we have those. It might be a matter of working with our AG to make sure we have the proper
Okay.
documents on there as well.
Sure, and I think there's a way you can do it that minimizes the amount of work you have to do over and over as well. I mean, I think the beauty of a one-size-fits-all document is that people can see what the process really is. Maybe something's been revoked, maybe something's been denied. They can see all that. I just think the more information, the better. Thank you.
I'm not disagreeing. It makes our lives easier too, because if
I
you don't
think
do
so.
it every day, we can even go back and refer to it.
I think so. I think it would.
Yeah, thank you for that feedback.
Thank you. Thank you.
So this is the only one we asked for a decision on, so, and I have never been in a meeting where we've asked for a decision.
Yep,
So
I
I
know.
don't, I don't know that part of the process, I'm sorry.
Or just
Are
makes a
are
motion
you
to
guys
accept them.
willing to make a decision right after we saw the stuff? If you are, great.
I mean, I think we've done this in the past with like some enterprise funds and things like that after discussions, so, but I don't see why not, but I'm not making a motion, I'm just agreeing with you.
You're not making a motion. Somebody needs to make a motion if we're gonna do this.
I think here's my quick take on this, and I understand where you're looking at expense versus current fees and such. It's not obviously on you all, but, 12 years is an awful long time to go without increases getting it within range. I mean, you're talking a $215,830 difference on that chart there. I mean, that's significant. It's actually frightening, I think. And then you're looking at the
These are the
economy we're
things
in
we've
right
been
now, it's
looking
even
at.
more
Yeah,
frightening.
We
I was
agree.
scared when I looked at it, too.
And I'm by no means criticizing you. I don't want you to take that the wrong way when I ask this. When did you first become aware of this when you got on the job, that there was this massive gap?
I don't know that we discussed these in particular, because there were other issues until last year, when we
Okay.
started to really be able to dig into different programs.
Okay.
Because there were other things, and I've had that conversation with Commissioner Kyler, where we were kind of doing flow charts and out workflows, and trying to get to a place where we had a software management system to handle our policies, because we were using the Google Drive, and when you looked up a policy, you would get 1,000 documents, and I am not exaggerating, 1,000 documents that had those words in it. And we had a hard time finding the correct version. So now we have a policy management system where and that just went live in September. So we've had multiple layers of work going on to try to straighten things out. So, like I said, we didn't have a dentist for almost a year, so we've just got our dental back up and running. So we've been working on the highest priority
No, I
item at a
understand.
time.
I'm just stupefied, for lack of a better way of putting it, that in 12 years, this hasn't been at least adjusted over time. I mean, it would sort of be like what we do with some of our things if we weren't adjusting them. I mean, I don't know where Commissioner Rothstein's thoughts were. I know you mentioned earlier the idea about the public having some
Yeah.
input, because it is a huge jump.
Well, because I agree with you that it's been 12 years and adjustments need to be made. It doesn't seem like there's a lot of sticker shock in any of these adjustments.
And that's kind of how we looked at them.
Right.
Well, why there wasn't really just a percentage across the
Right.
board. It was,
Right.
we still wanted to maintain that business-friendly atmosphere.
And that's
Well.
where I was going with asking, would this stifle any development? How would this be addressed compared to other communities? I do have awareness of other jurisdictions that charge a whole lot more than what I'm seeing here. So without a sticker shock effect that this addresses, being such a 12-year gap, this will tighten the shock group and getting closer to what we're, what you are trying to achieve, in the work necessary to do this. I'll make the motion that we accept all the fees requests that had been presented to us this morning.
I'll second it, but I do have a question about process, and Tim, maybe you can answer this. I don't think Ted's in the room. Is this something that would go into effect immediately, or is this something that goes through the budgeting process? I mean, how does this ultimately affect things, especially with respect to the budget itself?
Does your statute address that? I don't have it in front of me.
No, and we weren't looking to start them tomorrow if they did pass. We were thinking of a start date of January 1, just to make it a round. It gets us to be able to get our information up to date as well, with the forms and those types, with the different fees going to be associated with it. So yes, we were looking for potentially January 1.
So will we put that into our motion to effective, or just leave it as is?
I'll make a friendly,
Effective 1 January 2025.
So,
do I have to second it? Second.
Yep.
I thought that was friendly.
Yeah,
Oh,
yeah.
second.
Yeah. A couple questions, and again, for the public as much as us. The costs you're talking about are paid for by the state, in theory, and you're recapturing it. You've had some state money lost, taken away this year. If you could comment on that, and then how will this be reflected in your budget? Does, like when we do an enterprise fund, some of the commissioners in the past waited a few years to increase sewer and water, and then it's a big increase. But if you don't increase it, all the taxpayers are paying for a portion of the water and sewer that they're getting. So where are you, what money will this save in what part of your budget, and have the state cuts kind of contributed to this or not?
So,
I didn't
Want me to
say it
handle
would
it?
be a
I got
simple
it.
question.
I got this one. So we did have a 10.68% fee decrease, budget reduction from the state. And we worked very hard. Partly, it was savings from environmental health because they decided not to fill 2 positions. We've decided not to fill a couple of vacant positions. Our business negotiation, where we were in a bad business decision, where we were giving more services than we were collecting, we renegotiated. We asked them what they needed, and we are only providing them with the services, so we were able to recoup most of that. This, in addition to the state core, the county money that we get, the biggest part of our budget is categorical grants that we receive, and we are obligated to collect fees for any of the services we provide, whether they're medical services or whether they're, and the medical side of things is on a sliding fee scale. I have never heard the side of the environmental side using that sliding fee scale. I have heard of tax cuts and things that come to people who are working on affordable housing initiatives. So what we would do, so our fees have been, the fees we've been collecting have been going down, down, down in comparison of the money that we've been getting. And that's just looking at the economy in general. Things have been costing more. We've had pay increases over the last 12 years that have been exponential in our budget. So last year, I believe we talked about this, when the state did whatever they did in calculating how much the county's portion of the money was going to be coming to the health departments. It was 12 counties that were out of compliance, and they had to figure out that. So that's part of what our fee collection goes to, is making sure that we can balance those without having come back to you and say, well, you've always given us an overmatch and we need a bigger overmatch now. And we don't want to do that, because either way, somebody's paying for it. Whether it's the taxpayers for money that you're giving us, or whether it's taxpayers who are, providing a business in Carroll County. And what we're saying is that this is the cost, that this is what it costs us to provide that service, and we just want to pass more of that cost on to where it needs to be, instead of trying to figure it out in our budgets somewhere.
Does the state have to approve any of these fee changes, or?
This portion of our fees are for you all.
Yeah,
We have to
so
go
the
through
state
the
doesn't
Board of
have to
Health
do
to get
this
these fee
portion.
increases, and the county has to agree to them. The portion that we get from the state is, we usually use usual and customary fees for medical services. And then there's a set of services that are listed as non-chargeable. Those are things that we do in a correctional agency or that are related to health services like HIV or TB or things like that. We don't charge for those because they're public health.
Right, and I do want to add that we still don't charge, we won't charge schools, the nonprofits, counties, state agencies for licensing or those types of things either. We will continue to do that, so.
So the schools don't pay for their food service facility licenses and things like that. But we go and we do the inspections and we work with them.
We have a motion and a second. Any further questions or discussion? All those in favor?
Aye.
Opposed? Made it.
Thank you, gentlemen.
Thank you.
Appreciate it.
Under the heading of, I was told to keep this short, and now we've gone way long on this.
Yeah.
I am gonna do the fastest presentation. I'm gonna bring the Jersey out in me and do
There
the
you go.
fastest presentation of the community health needs assessment, because I think it's important for people to understand how all the pieces fit together. The community health needs assessment is the process for assessing health in Carroll County. Maggie, if you want to come up, if you're still back there. You can come on up. The community health improvement process involves an ongoing collaborative, community-wide effort to identify, analyze, and address health problems. So in essence, the hospital, which the community health needs assessments are required by the Internal Revenue, by the Patient Protection and Affordable Care Act of 2010. So what we do is we work, the hospital is mandated as a part of that Internal Revenue Code to do a community health needs assessment, and they are mandated to infuse the community with funds for identified areas of concern in their community benefits plan. So they look at the community that's served, we look at the process and the message used to conduct the assessment. We should thank the county very much this year because they helped publicize the community health news assessment, and we were able to get twice as many surveys back from the community as we usually do. The methods include input from people representing a broad interest of the community. All the significant prioritized community health needs are identified in the community health needs assessment, and then there's a process and criteria for prioritizing them. They do focus groups, they do key informant interviews, and then there's a group of people that sit down and go through everything that was identified in the needs assessment, prioritize them, and then decide which areas we are going to work on for the next year, for the next 3 years, actually. So as a part of that process, that's a piece that the hospital does. The piece that the state does, which as through the local health department, is the Local Health Improvement Coalition. And that coalition is a group of local stakeholders and community members that meet to identify and address the health priorities. And the LHIC is designed to convene a wide range of community voices and to coordinate health initiatives with population health priorities. All right, so then we have work groups. So
I apologize. Who's on the LHIC?
the LHIC is, I'm getting there, but, so the LHIC has 4 work areas. This is the community health
I
work.
mean, are the
We have
people, are
nonprofits, we have
they
community
Carroll
members.
Countyans?
Carroll Countyans, only, all Carroll Countyans,
They're all Carroll Countyans, both government, nonprofit, and
community members
Community
at
members.
large. Anybody can attend. So the local health improvement planning work groups address specific focus areas within the planning process. So this goes to the work smarter, not harder. If we have 25 agencies in Carroll County that are working on diabetes, we want them at the table telling us what they're doing because we don't want to duplicate efforts. We want to enhance the efforts that are going on. We want to look at grants that may be available, but not for us, but for these community agencies who are impacting this change. So we want them to help us identify where we're having successes, where we have gaps, where we have barriers, where we have challenges. And then we, as the hospital and the health department, and the county, because we do have county participation on these work groups, work to address those gaps, barriers, and challenges, or work to try to find funding for the successful things that we're doing. It doesn't always have to be us that's doing it. It can be, and that's what we want. We want it from the community up. So we partner, the hospital and the health department partner with the Health Partnership for a Healthier Carroll County to complete that local health improvement process. So Carroll Hospital, a LifeBridge partner, must by law complete the community health needs assessment. They also complete their community benefit plan based on those findings, where they're going to invest their money. The Carroll County Health Department must develop a local health improvement plan, and it needs to include data from the health improvement process. The partnership is the partner agency that both agencies use to develop those plans and processes. And many agencies convene to review that data and determine the top areas to include in the hospital's benefit plan and the local health improvement plan. So this is just for your reference, the state's priority areas this year. They examine all of the health of all Marylanders. And this year their priorities are chronic disease, access to care, women's health, violence, and behavioral health, including harm reduction. They have health equity and social determinants of health identified in each one of those areas. So what that means when we say that is we're looking at the people in the community that are most affected by those disorders or those or lack of access to care. So if and the easiest example I've had is one of the suicide data we've been looking at in Carroll County is when we started looking at our suicide data, we realized that suicides by gun were most prevalent in our younger population and our older 60 populations. So we want to target our efforts at those two populations. That's what we mean by health equity. We want to target the efforts to the most appropriate people. Priorities for FY25 and FY27 for Carroll County are mental health, diabetes, heart health, and cancer. All of those also include social determinants of health. So we're looking at, could we improve somebody's diabetes if they had access to healthier foods? And how do we get them access to those healthier foods? We work and partner with Citizen Services and also with Westminster Rescue Mission. They have created where people can get a hot meal every day, as well as they distribute food for the county. And in addition to that, when they get odd items, they distribute recipes on how to use those items and how to incorporate that food into a person's diet.
Do each one of these have tangible goals, like
Yes.
in an end state that you know?
I didn't drill it down that far. I just was trying to say,
No, I
show how we all
understand
kind of,
you're trying to
So
go
each
fast
one
on
of-
this, but if you're making something a priority, knowing what resources we're putting against a priority, knowing that it's gonna achieve its goals and objectives, how do we know when we get there?
So that's one of Maggie's jobs as convening the Local Health Improvement Coalition. So we bring all of those partners together, we look at the areas they're working on, and then every 3 years, we evaluate those to see, well, it's not every 3 years, it's an ongoing evaluation. But then we finish that and we try to understand whether this priority has been addressed. I can tell you that mental health and diabetes have been on there for 10 years? At least. Because as we move the needle on one thing, we're finding other things that we need to address.
Do we publish the results?
The Partnership for Healthier Carroll County has a vital signs paperwork right on their website, and then we do our annual report. But yes, all of those items, and we're restructuring how we're working together as the partnership, the health department, and the hospital. Mr. Hoover and I are working together to try to guide that process forward. We've decided to have quarterly meetings where we are actually being informed of what's going on with each of those work groups, and we are going to give direction on, where we need to go from there, or how we want to see that going, based on what we're seeing coming into the hospital,
Yeah.
and also based on what we're seeing in the secondary data, which is very important data, where we can see what's, other things that are driving
Right.
these forces.
It's a great idea. Okay, thanks.
This is Amy already. I did a really fast one. Sorry. I was just trying to make up time because there's some really good information coming up, and I don't want to bore you all to death. But hot off the presses, I believe, hot off the presses, Maggie does have a copy of our annual report for
Great.
all of you on the services we've provided and what we've done. And
And Amy's been going up and down for about the last minute or two, so. You coming up now? Should I don't know.
Yes.
It's up to her.
You're up. And there's a lot of good data in here, and that's why I wanted to kind of rush through my piece, and I also want to get to the other two pieces.
Okay, I'll get myself down. Good morning, Commissioners.
Morning.
It's good to see you all again. I'm just going to get myself arranged and settled. I have all my notes. Hello. I'm Amy Lajel. I'm the Director of Prevention Services for the Carroll County Health Department. What we wanted to share with you today is some really fresh data, even though it's 2 years old, but we just got it. You know how that works. That is super important and impactful, and it's just a wealth of knowledge. So I'm really giving you just a snapshot here so you know kind of the scope of this data. But I'm more than happy to send a more full report for you to be able to go through, thoroughly and see all of it. So what I'm talking about today is the Youth Risk Behavior Survey, and this is administered, it's a partnership between the Maryland Department of Health and the Maryland Department of Education, and it's administered every other fall in the even years. Now, of course, COVID kind of got us off track a little bit with that, but we are back on track. And so the data that I'm going to be presenting to you is from a survey that was administered in the fall of 2022. And so this measures a lot of different sort of risk behaviors, whether it's substance use, mental health, but it also measures social determinants of health, and as we're going to spend a little bit of time talking about, adverse childhood experiences. So social determinants of health like food security, neighborhood, things like that, but also behavioral health things, disabilities, unstable housing, bullying and violence. And this data allows us to more proactively and effectively direct resources and programs, like Sue said, especially from a health equity perspective. Who is really being impacted by this, so we can appropriately direct our programming. So what I'm going to do is just give you an overview of the data. I'm going to share just a few of the substance use and mental health indicators, and then we're going to get into the ACEs. And then what I'm going to do is share some of the takeaways, both from me, but also the state epidemiologist, Nacardi Hines, from the data. And then I'll share just some of the things that we can all do, because it's always nice to end with a sense that there really are genuinely things that we can do about this. So with the substance use and mental health trends, do I do it? Oh, okay, thanks.
Got it.
So we're going to start with middle school. So the survey is administered in our middle schools and in our high schools. It's optional. Students don't have to take it. There's also a parent opt-out. And they also, if they do take it, they don't have to answer every question. And so when you see that total number of students who took it, that's not necessarily the students who answered every single question. And just a couple other notes, when we get to the mental health and substance use slides, on a couple of slides, there are multiple trends on a single slide. If you're looking at a printout, it's very tiny, and I can get you something bigger. But note the scale. So what you really want to look at is the number. So there are different scales represented on those different slides. So one may be 1 to 4, one may be 0 to 100. So just want to kind of alert you to that. There are also more indicators on the bar graphs, and we're going to go through all this, but there are more indicators on the bar graph than there are trends in the graphics, and that's because some of the questions are so recently asked. They haven't been asked for the past 20 years. They've only been asked for maybe the past 2 surveys, so we don't have enough data to establish a trend. Okay. So for middle school, and just as sort of an aside, if you have any questions about the questions, please let me know, because I'm happy to read you the actual question that was asked. So for middle school, we're showing you the mental health factors first. And as you can see, the percent of students who felt sad or hopeless, and this is really feeling persistently sad or hopeless for a period of time and having it kind of interfere with your ability to do the things that you normally do. So we have about 31% of students who said yes. And then you can see as we go through the subsequent mental health and suicide-related metrics that it does go down. With 26.6% reporting that their mental health was most of the time or all of the time not good. So the students are asked a question, they're given different options, some of the time, all of the time, et cetera. And so most of the time and always were the ones pulled for this one. Ever seriously thought about killing themselves is 1 in 5 students. Ever made a plan about how they would kill themselves, and then ever tried to kill themselves is 8.4% of students. Again, fall of 2022, just to keep that framework in mind. And this is consistent sort of with, I'm sorry. Oh, this is consistent with when we look at suicide-related data, what you see is a percentage, but for every completed or even attempted suicide, there's always a much larger population that is experiencing these persistently sad or hopeless feelings. And so our hope, of course, is that we can implement programs that will prevent students from shifting down the scale and that behavior worsening. So yes, we can go to the next one. Okay, so these are the trend graphs, just for your information. I'm not gonna linger here because you have them, and I wanna move forward so we can spend a little bit of time on the ACEs data, but any questions you have specifically about these trends, I'm more than happy to answer, and our epidemiologist also prepared some reports that show which ones are sort of significantly increasing or decreasing. So moving on to substance use in middle school. Again, we didn't pull every metric. There are many, many, many data indicators. We just pulled a few. So I'll just let you take a look at that. Cigarettes, alcohol. So this is the percent who currently use. Some of the data, it asks questions in multiple ways. Have you ever done this? Do you currently do this? Do you do it daily? So we like to look at current use. Ever could be, well, I did, but it was 5 years ago. So that's not a really good indication for us right now of what's going on. So we want to make sure we're looking at that. So about 6.3% of middle schoolers at that time said that they currently use alcohol, which of course, from a prevention perspective, we also want to remember that's over 90%, over 93%, prevention math, who are not currently using alcohol. So going on to the trends for this, again, I'm not going to linger here with the trends. You have them, and you're able to see them. We're going to go into high school and talk about the same things, and then we'll get into ACEs. We wanted to give you, the state epidemiologist, Nacardi Hines, does a great report of this every year. And she pulls out all of the demographics so that we're able to see the students who took this survey and, use that information again to kind of help us get to know our county. So if we go to the next slide, the percent of students who, these are the same questions that were asked of the middle school students. You can see that 36.4% of high school students felt sad or hopeless. 30%, a little bit above 30%, their mental health was not good most of the time or all of the time. 20% nearly seriously considered attempting suicide, and 14 made a plan of how they would do it. 9.5 of our high school students in 2022 reported that they had actually attempted suicide. We'll go on. Again, I will not linger over the trend lines, but you can take a look at them. The next metric we'll cover, and the final one before we get to the ACEs, which is a little bit more complex, is the substance use for high school. So we have, of course, cigarettes, e-cigarettes represented, cigars, smokeless tobacco, alcohol. And so again, they're looking at who currently uses, which is defined as X number of days in the past month. And so that's 24.2% of high school students at that time indicated that they currently use alcohol. Then the next slide is the trend line. So we're going to move forward now with the ACEs data, but I do encourage you, and we can send you the complete report. I just can't say enough how much of a wealth of information this is. It's questions about all kinds of things, concussion, all of these sort of different predictors potentially of other impacts around behavioral health that we don't normally associate with that. So we'll make sure that you get that so you can take a look at it.
We have a meeting set up with Celine Steckel and Ed Singer to present to the local management board, but I want to focus the presentation on what they want to hear as the local management board on this data. So we're going to talk next week and get that data together for them.
Absolutely. So we're looking at adverse childhood experiences. You are probably familiar with adverse childhood experiences, but just a quick review, they're potentially traumatic events that can occur in childhood. Know that ACEs are common, but also know that they are dose dependent. So having one will increase our risk for X, Y, and Z. Having 4 will significantly increase our risk for X, Y, and Z. And the effects do add up over time. It is a little bit of a cumulative effect. So the impacts, I think we kind of understand intuitively that if we're mistreated or we're in a household environment that's not helpful or is hurtful, that we may develop some substance use or mental health issues. I think that's intuitive. What's less intuitive is the fact that these ACEs are also predictive of serious chronic physical health issues that carry a really significant disease and also economic burden for our community. So I just kind of wanted to frame that for you so you could keep an eye towards that as we go. So depression, cardiovascular disease, diabetes, cancer, other things like that are linked to ACEs. I did want to just spend a brief moment talking about why that happens. So essentially, a child is experiencing an extreme stress event or chronic ongoing stress. And that actually changes the neurodevelopment in the brain. And that change can result in less of an ability to, say, control impulses or behavior learning, things like that. It also shifts how they're able to cope in a healthy way with different situations, which can then mean that they end up using unhealthy methods to cope, which can then, after that, mean that they are more likely and more at risk to develop these chronic illnesses or a substance use disorder or a severe mental health disorder. So just a little bit of sort of the why behind this. And I want to start with, okay, so the categories are maltreatment and household challenges. All eight of these questions are asked for high school, 5 are asked for middle school students. So we are starting with, oh, that's okay. It's totally up to you. Oh, that's okay. So we are going to start with middle school. I only pulled one category for you, but again, I'm more than happy to share the rest of these. I do want to go over this slide. It's a little bit tricky. There's a lot of information. So this is household substance use, and the question students are asked is, have you ever lived with a parent or guardian who was having a problem with alcohol or drug use? So have you ever lived with a parent or guardian who was having a problem with drug or alcohol use? 16% of Carroll County students, middle school students, indicated that they had. Also of note, 14.3% in the entire state did. So we're just a little bit above the state for that. Now, the other really interesting thing about this analysis is that it analyzes these answers to the ACEs questions in relation to the students' other answers about different problem and impactful behaviors. So for example, cannabis, the first one. So of students reporting household substance use, I am so sorry, I think I'm on the wrong slide. So of students reporting household substance misuse, 9.5% ever used cannabis. But of the students who did not report that ACE, 1.5% reported misusing cannabis. And it goes down the line nearly without exception for every ACE and every problem behavior. So with suicide, of the students reporting, the middle school students reporting household substance use, 44% have considered suicide. Of the students who did not say that they had experienced this particular ACE, 16.4% had considered suicide. So that, again, is the only middle school metric I pulled out, but there are 4 others, and I'm happy to give you all of that information. So we're going to shift to high school more. And so for high school, we chose 2. And the first one is emotional abuse. And the question is, during your life, how often has a parent or other guardian in your home insulted you or put you down? And the state epidemiologist chose to include all of the answers that were anything, had it ever happened, which is how a lot of the ACEs questions are worded. So what that means is 62.7% of Carroll County high school students said that they had ever had those experiences with a parent or guardian. And that's compared to 59.3% with the state. So again, we're very close, just a little bit above that. With respect to how that is analyzed with the other impactful behaviors, of the students, the high school students that reported ever experiencing emotional abuse, 16.4% misused a prescription pain medication. Of the students who did not report in the survey that they experienced emotional abuse, 5.5% misused a prescription pain medication. One more metric, and then we'll move on. Not quite, almost.
Sorry.
So that's okay. That was my mistake. So of the students also who reported that ACE, experiencing emotional abuse, 48.3% reported being persistently sad or hopeless. But of the students who did not report that, 15.7% report being persistently sad or hopeless. And again, a lot of this is just very intuitive. You know, if we're experiencing those sorts of situations at home, of course we might be persistently sad or hopeless. I think what we have to keep in mind is, again, the decades of research behind ACEs of how predictive this is later on of physical disease, mental health disorders, and substance use disorders. Okay. So the last metric we're going to go through is household mental illness. So the question is, have you ever lived with a parent or guardian who had severe depression, anxiety, or other mental illness, or was suicidal? And so 29.5%, sorry, of Carroll County High School students said that they had ever had this ACE present in their home. And 23.3% of Maryland State all together. And so just a couple things to point out here. What this means as we look down this chart is that of the students who reported that, yes, they did experience household mental illness, 25.9 reported using cannabis. Of the students who did not report that they experienced household mental illness, 9.8 reported cannabis use. Tobacco, of the students reporting household mental illness, 48.3 reported tobacco use. And of the students who did not report household mental illness, 15.7 reported tobacco use. So as I said, that pattern continues almost without exception. It's not as pronounced in the physical neglect ACE. And I'm, again, happy to get you all that information. The next one is sort of like a summary that the state epidemiologist did for us, which essentially is just an ACEs count by risk behaviors. So for example, and it's always the number of ACEs compared to 0 ACEs. So if you look at that very back row, it's having, if a student indicated that they had 5 or more ACEs, this is in comparison to a student who indicated that they had 0 ACEs. Students who indicated that they had 5 or more ACEs are 20 times more likely to consider suicide than students who have 0 ACEs. So again, I'll let you kind of linger over this particular graph. I'm always available to answer any questions, but I do want to make sure we also get to some of the positive childhood experiences. And so we can go ahead. So the good news is it isn't only the adverse experiences that impact us, it's also the positive ones. And that is really good news for us because, as you know, one of the strengths of our county are the partnerships that we have. And a lot of good community-based organizations, a lot of health and safety organizations are doing a lot of really good work around this. So positive childhood experiences are things like having that adult that you can turn to, whether it's in your family, whether it's at school, whether it's a coach, whether it's a mentor, somebody who really cares and is really listening to your feelings and to the things that you're excited about, to your goals. Making sure you have at least one, preferably 2 non-parent adults who take a genuine interest in you. And so you're going to see how much the positive childhood experiences are community focused. It is nice when they are coming from the household, but that's not always possible. And so some of the things that we'll talk about are how we can really provide some support to our families who may be struggling. So go ahead, the last one. And so in the same way that we were able to, that the state epidemiologist was able to analyze the ACEs data with those impactful problem behaviors, we were also able to do that with the pieces. And so what was found was that Carroll High School students with at least 2 pieces were less likely to have those poor mental health indicators and metrics. So a couple of different takeaways from the state epidemiologist, and then if you'll permit me, I'll give you some of mine too, and then some of the potential action steps that we can all take. One of the things she said that I think was really important and interesting is that surveillance on ACEs, data collected on ACEs, is often done retroactively. In other words, it could be someone asking an adult, have you ever experienced these things? And I actually have the adult ACEs questionnaire if you'd like to look at it. It's the same questions. Have you ever experienced a parent, hitting, or did you ever experience sexual abuse? So any one of those. So being able to get it while students and children in the community are actually living in that period means there's going to be less recall bias. They're actually experiencing it right now, so they'll be able to answer that. The second thing that we all wanted noted is there are significant inequities, and we didn't want to overwhelm you with splicing too much data, but I do want to provide you some more data on this directly. There are significant inequities by sex, race, sexual orientation, and gender identity in Carroll County. Again, almost down to the ACE, almost without exception, and it's really interesting. And it's really important that we're aware of that, because if you noted on the high school slide, almost 1 in 4 of our high school students identified as LGBTQ questioning or other. The last thing she wanted to note is that high school emotional abuse, household substance use, and household mental illness are significantly higher in our county than in the state. So she looked at both how these different metrics interplayed together, but also how we compared to the state, and I have all of that for you. She also said that physical neglect and physical abuse in high school are significantly lower in Carroll County than compared to the state. So a couple of brief takeaways before we get to, some potential action steps is, again, just to frame this with respect to the decades of research on ACEs, the data that we're talking about now with middle and high school students is really going to impact the community for the next 20, 30, or 40 years. And so even though a person's own behavior and choices absolutely do impact their health, there are also a lot of other non-medical factors that do impact and exert a great deal of influence on our health, whether it's safe housing, transportation, discrimination, violence exposure, just education, job opportunities, and income, things that are kind of talked about all the time, although not necessarily in the context of behavioral health. So really, we can't really look at those problem behaviors, as we call them, in a vacuum. Substance use, we can't prevent it or treat it without looking at the entire context of the community in which it's occurring, which is why with prevention we do look at across the lifespan. We look at all the different domains. There's the child, there's their peers, their family, there's the house they live in, there's the school they go to, the community, the neighborhood, the social media, super peer. There are so many different influences, but also opportunities. And I think the other thing that ACEs can tell us is that instead of kind of siloing those different behaviors, we might consider that in a lot of cases what we have is maybe not a substance use problem, maybe we have a pain problem. Maybe children are in pain from a lot of different situations they may be experiencing, whether they're chronic or just a single extreme instance, and these are the resultant behaviors. So a couple different action steps, and then I'll wrap it up. Again, the good news is that ACEs are preventable. And preventing them can help both the children's, but also the adults in our community who were these children, who may be still suffering from this, can help them thrive. And it can lower risk for conditions like diabetes, asthma, depression, and reduce risky behaviors like smoking or heavy drinking, which also contribute, again, to a pretty significant disease and economic burden for the county. And it can improve education and employment potential. So a couple of things that we can do that are kind of considered best practices around ACEs. And again, the great news is that we live in a county that does all these things and that really embraces this, is really work to enhance those connections to caring adults and increase parents' skills to be able to have those meaningful connections with children and also manage emotions and conflict in a healthy way. We offer several free evidence-based, really family communication programs that anybody can avail themselves of. We're able to sort of offer them on demand. Healthcare providers can recognize the risks of ACEs, both in children and also in adults if they're doing an ACEs screening, and they can refer those children or those adults to effective services and support. And then, of course, communities can ensure that there are the social and economic supports that address the financial hardship and other conditions that sometimes families find themselves in that increase a child's risk for ACEs. And the last thing I'll say is everyone can promote 988. And I know you guys hear us say this all the time, and you also do this yourselves all the time. Just really normalizing early intervention for any issue that's happening and normalizing that help-seeking behavior, and all of us just kind of continuing to work to decrease stigma.
I think that concludes you.
Thank you
right?
very much.
Me.
All right.
I'm happy to take any questions or just follow up with
Yeah,
sending you.
definitely would like more information.
Yes, happy to.
Appreciate, and you know how I feel. Appreciate all that you and the team does. Thank you.
Absolutely. Thank you very much.
Thank you.
You still going?
Yeah.
I know, I thought maybe you were at the lunch break.
Keep going.
Okay, well, good afternoon at this point. Just like that, we've gone from
afternoon.
morning to afternoon.
I was all ready to start with a good morning greeting, but
My name's Amy Baker. I am from the Behavioral Health Bureau at the Health Department. I'm the Program Director for Special Populations, and I'm going to let Adrienne introduce herself.
good afternoon. I'm Adrienne, and I am currently the Harm Reduction Program Supervisor at the Health Department.
Afternoon.
afternoon. We're going to be telling you about our harm reduction program. So we actually do have a very brief presentation. So we can start with, I do want to go back, Sue, to actually to the first slide, really, because it's a conversation about what harm reduction is, and I'm going to let Adrian start with that, if you don't mind.
I mean, sure. Very broadly, harm reduction is something that we do a lot. As you can see, the picture in front of you is a seatbelt. Hopefully, we're all buckling up every time we get in a car. Though, if you have been around a little bit like I have, you might remember being put in the back of your parents' car, tucked in the back without a seatbelt. There was a time they weren't included. So they really, truly are a harm reduction effort. We don't know what's going to happen when we get on the road, but buckling up can help us kind of mitigate risk, and that's really what harm reduction is about, just mitigating risk.
Thank you. And similarly with bike helmets, right? We can remember a time when that was not the law. It became the law because it mitigates the risk of harm from riding a motorcycle, having an accident, sustaining a head injury, et cetera. So what we really want to talk about is what is harm reduction. We do have a harm reduction program in the community. To date, it's been the idea of what Johns Hopkins School of Public Health says here. Really, it's reducing the harm associated with using drugs. It is a drug harm reduction program. And that's through a variety of interventions. So the concept really relies on the fact that these tools begin with the fundamental thinking that everybody's life matters, and all people deserve safety and dignity, right? And that it doesn't treat drug use like a moral failing. We know that our county doesn't do that, and none of us wants to treat people who are in the throes of substance use or addiction as people who are failing. We know it is a disease of the brain. So that is what our harm reduction kind of focuses on, and then we're going to give you some more specifics about what we do in a harm reduction program.
This is just kind of, there are a few examples, if you will, about strategies that are in place and just nationwide outside of our country that are considered harm reduction strategies. So drug testing just refers to test strips. If you've heard of fentanyl and xylazine test strips that can be distributed to people so that they can test for contaminants that are put into their drugs. What's the second one on there? Drug user education is really just health education, teaching folks about the risks that they might incur, as well as how they can mitigate those risks. Again, it's all about harm mitigation. You've probably all heard of medication for opioid use disorder, lots of medications. It's actually considered the gold standard, although it gets a lot of flack and it's stigmatized a lot, but they can reduce the risk of overdose and certainly fatality in half for some of the ones that are available to people. And it's about managing core symptoms, about the symptoms of drug use. Naloxone, hopefully all of you have heard of naloxone. And you know about the purple boxes. Naloxone is absolutely a life-saving harm reduction strategy. In our county, we quadrupled our distribution, so it's out there everywhere. So hopefully everybody knows what it is. But sometimes I'm surprised when I find folks who don't. And then, of course, syringe service programs, which are programs that aren't just about handing out clean needles. It's about collecting needles for destruction, appropriate disposal. They also lower the risk of HIV, hepatitis C, other infections that can certainly be incurred, as well as decreasing overall drug use, which is counter to a lot of beliefs out there. And the most beautiful thing I think about it is that people are 5 times as likely to enter treatment by being engaged with a syringe service program.
So are these all things that the Department of Health does here in the county? Drug testing, giving out syringes, this is stuff that we do now? Or it's not
Not yet.
Not yet.
So what we've been doing so far for the past 3 years is the drug user education There's MOUD, the medication component that we don't do personally, but lots of the programs providers do here in the community.
So one of the programs the detention center's
And the
mandated to
detention
do.
center, correct.
They're mandated to provide it to anybody who's an opioid user.
Really risking the symptoms of withdrawal and making it easier to abstain from drugs, of course, if that's where people are. Naloxone distribution, of course, we do. We are
Right.
the main provider of naloxone in the county. And so our focus for harm reduction so far has been not asking for people to abstain and really do peer support and education for people who aren't quite ready for abstinence. And so we provide supportive services, link them to treatment when they are ready, and really just kind of walk that journey with them at this point. So,
But as far as drug testing and giving out syringes, that is not something that we are
we have
doing.
not done, we do give out the xylazine and fentanyl test strips to people so they can test their own drugs.
So, and I have to ask this, and I don't mean to be brutal or anything, but I mean,
Okay.
what is the difference between harm reduction and in the end just enabling somebody, right?
It's a common question, so thank you for asking.
I mean, I think
Yeah.
it probably goes to the core, the fundamental core of the issue, right?
Okay.
Because you
Absolutely.
know, I certainly don't want anybody to be addicted, but I also don't want to be enabling somebody to continue to be addicted either.
So if I may, the whole idea of harm reduction is really to have a touch point with somebody. And every time that you're meeting with them, you're talking about the idea of the potential for treatment. You're talking about the idea of life versus death. So every time we meet with somebody, it is an opportunity to talk about further mitigating those risks of harm from substance use, the worst being death, of course. So where people are going to use drugs, whether we are working with them in harm reduction programs or not. And that's really the idea of it. It's the idea of keeping people safe if they're going to continue to use drugs versus they're just out there using and they're not safe and they're spreading disease and they're spreading those infections that we want to prevent from happening. We want to keep them as healthy as possible until a time where they are hopefully ready to abstain from drug use.
Use of drugs, though, in and of itself is not a safe thing.
Correct. So we really
So-
refer to it as safer use, right?
Is there honestly such a thing, though? Any kind of safe
Absolutely.
drug use?
Yes.
I don't think so.
There
I don't-
absolutely is.
But that's why you have addiction, though.
Well, addiction is a disease. We know this, right? So again, not a moral failing of people. We're not blaming the people.
Right, and
my
neither
colleague,
am I. I'm not trying to get to the moral heart of the issue. I'm trying to understand from a physical perspective, right? From, again, I don't want anybody to be on drugs. I don't want anybody to be addicted. And if somebody is addicted, I want to be able to get them help.
Right.
But I really have concerns from an objective epistemological standpoint when we talk about safe drug use, because it's almost like we're condoning the drug use by saying there can be safe drug use when there can't. Because as you said a second ago, the ultimate, the absolute worst outcome is death.
Correct.
And so I really do worry about the term, and your words do matter, right?
They
And
do.
and I'm not trying to again be brutal or to dwell on this, but again, it strikes me as somehow incompatible for us to say that there are possibilities and opportunities for safe drug use that would somehow mitigate the danger of the drug. But it's not the case, though, right? Because the drug is still dangerous.
The drug itself is still dangerous. We can't control the drug supply. What we can control is how people use and whether or not they test and whether or not they have safe implements to use those drugs. So we're not controlling the drug supply. You're absolutely right. But the other thing that we're doing every time we give somebody education or peer support or any, wound supplies or drug testing strips is having a conversation with them. Let's talk about how your drug use is impacting you in your life. Let's talk about the dangers of drug use. Let's talk about the fact that you have goals to maybe include getting your children back or going back to work. And how are you going to accomplish that when you are right now in the throes of addiction? So the fact is that we can have these very non-judgmental conversations with people who might be out there much longer using drugs, if not for this harm reduction model.
And I don't take away, again, I'm not trying to dwell on it. I'm not trying I'm really trying to get down to the core and understand this, because again, it seems to me to be at best a paradox that we are saying don't use drugs, and here's material to test your drugs.
Right. Yeah, did you want to add?
I think really the bottom line is we've been telling people for like 100 years not to use drugs, and they're still using drugs.
So does that mean we stop completely and say, throw our hands up and say, go ahead and use them? That would be countervailing to the what we're trying to accomplish, right?
But I think that's where harm reduction comes in, is because we have yet to be successful to stop it completely. I'm with you. I would love it to not exist because I don't want people to die. And so obviously, I think everybody can agree on that, right? We want to reduce death, and that's really the bottom line about harm reduction is. It's not harm-free drug use. It's just harm reduction, and it's us trying to find ways to teach people to do something they're doing anyway without making it worse on themselves, if you will.
I understand it, but again, to me, and I'm not trying to be argumentative or anything. It's just, again, from the objective use of language, it really does seem to be, at best, a paradox.
And we certainly understand that thinking, right? But we also know from working with people over decades, we have decades and decades of experience at this table, probably over 100 years of experience, all together working with people who are suffering with addiction and they just can't stop. So we at least want to say, let's take it to a different level. You've tried abstinence, you've tried rehab, let's try this. You're not going to get people to stop overnight if they're not ready to. We can do whatever we want. We can jump up and down and talk to them until we're blue in the face. If they're not ready, the bottom line is they're not going to stop. It might be much more palatable to say, let's cut back what you're using. Let's give you safer supplies so you don't have these wounds that now require you to go in the hospital. You're not catching HIV or hepatitis C and spreading it to an entire community, which really costs a lot to our community, right? And hospitalizations and medical care and people who are uninsured, and we're paying for the care anyway. People are also dying of those things before they ever have the opportunity to say, I'm ready to stop using drugs. So this is our idea. It's not our idea. I'm sorry. Harm reduction's been around for years and years and years. So we didn't develop this idea. We're just now employing it in our county so that we are getting people into treatment faster when they're ready. We know studies say people are 5 times more likely to go into treatment that is abstinence-based when they are in harm reduction programs. And we know that every time we meet with them, there's a greater chance that they will go into treatment. Maybe not today, maybe not tomorrow, but maybe next week.
So if you take it back to the conversation we just had about ACEs,
Yes.
and you think of it that way, and you think of people who have been damaged by these traumatic experiences all throughout their life, and that they've made attempts, and they've been looked at as failing or immoral or not having enough willpower or not being strong enough. We're trying to develop that relationship as a trusted person with them, so that we can have those conversations. And once they trust us, we can have those further conversations with them. But we're trying to make it safer for the entire community overall. Any staff, the staff of the Bureau of Prevention, Wellness, and Recovery get called out many times and get called by agencies to say, oh, there's a whole bunch of syringes over there. Can you guys go over and clean them up? So what we're trying to do is people bring them back. And we get them out of circulation. They're not in a parking lot somewhere. I'm not going to name any of the places we've gone that we've been called to, but they are putting themselves in harm's way also. So we're looking for a better way to do that than sending it twice a year to the collection sites that we're asking people to bring them to. But can we have these relationships? Can we develop that relationship with the individual so that we can then become a trusted person in their life so that we can work with them? And I will share with you, in 42 years, I have been through every iteration of substance use treatment there is. I went through the iteration where when somebody had a mental health disorder, it wasn't safe for them to take any of their meds because in order to be abstinent, you were abstinent from everything. I don't think that it's helpful for mentally ill people who benefit from medication and can live a productive life to come off of their meds because we don't think they're sober or abstinent if they're on their meds. So there's been many iterations of what we do. most people see medication-assisted treatment as a crutch. But if that's a crutch that gets people to not use and not have a needle and not go out and do risky behaviors, other risky behaviors, or not spread Hep C, because we know that sexual favors and sexual trading sex for drugs happens. It happens in this community. We linked one case of Hep C to 50 different people. So we want to make sure that we're trying to do those, reduce those harms to the community overall. And that comes with having that personal relationship.
And I'm not disputing personal relationships. I'm not disputing the overall intent. I'm not disputing some of the aspects of the idea of the program of harm reduction. Again, going back to the fundamental issue of harm reduction versus enabling, right? I get what you're saying about, well, they'll have a clean needle, right? But are they really going to come back for another needle every time they need a needle? Or is that needle simply going to go into distribution in the community? So it's
You've worked on developing it, so you have the answers.
We can talk about the fact that there are these harm reductions, specifically syringe service, which we're talking about now, more specifically surrounding our counties. So Frederick County has it, Howard County has it, Baltimore County has it. We're one of 4 or 5
Former cities
counties.
had it for many years.
For many, they were a pilot program,
And
so.
their statistics probably don't prove a lot.
Well, the fact is, people do come back, and they do come back again and again to get the supplies, but also to have that humane interaction with people. So they're coming back for more than supplies. Sometimes it's getting food, sometimes it's getting safer sex, items. Sometimes it's coming back and returning their syringes. And so we've worked with Frederick County, who has really great statistics on what's going on in their syringe service program. I think it's important to note that we have not started a syringe service program in this county to date. So I think that's important to note. We have done all of the other harm reduction efforts to date. And so I want to make sure that that's clear. And we can talk about what more syringe services means. But enabling, you're right. Is there a fine line? Are you enabling when you talk about, and I'm just going to throw this out there, in the schools when you're talking about safer sex? And if you know children are going to, or high school students are going to engage and you're giving them the right tools to stay safe, is it enabling or is it a harm reduction model? So we're really just talking about what are we doing to keep people safe while they're still engaging in the behaviors they're going to engage in with or without us.
I'm sorry, go ahead.
Go ahead.
Well, I was going to
thought
say.
you were done. You hesitated.
Well, one last, I'm sorry, and I'll let my colleagues up here speak if they want to, but to me, that argument is, again, it's kind of almost self-defeating, because if it's going to happen anyways, and shouldn't we be taking steps to make sure that it doesn't happen? I mean, I understand that not everybody's going to be ready for abstinence overnight. I know that kids are going to do what kids are going to do, but does that mean we stop making the effort to
No.
try to stop them in the first place?
I don't think so. But I think because it doesn't always work, we have to have Plan B. So that's really where we are. We've taken people to treatment, driven them out of county to Annapolis, to here, to there, only for the next day for them to call and say, I wasn't ready, I need to come back. So what should we do with them? Should
I'm not-
we not, right? And that's really,
not
I'm
disputing a
just
Plan B.
proposing it back. Like, should we just give up on them, or should we keep hammering away that they should stop using drugs versus let's mitigate? If you are a person who drinks a fifth of vodka a day and that is causing wreckage in your life, what if we reduce that back to a half? And you can still drink, you can still get the whatever that does for you, but also maybe we're going to minimize the wreckage. You're going to be able to go to work tomorrow. You're going to be able to, pick your kids up from the soccer game because you're limiting what you're doing. And that's really where harm reduction comes in, that it's not an enabling, but actually a reduction in what's happening for people.
And again, I'm not disputing the Plan B.
Yeah.
Right? I'm just disputing
Thank
what
you.
the Plan B is, that's all.
Yeah. Yeah,
Commissioner,
thank you.
I'll
Okay. No, thank you. I have a personal thing, and then I want to put my commissioner hat back on. But the 4 bullet points under syringe service, there's not a lot of data. There's data that would disprove them. There are more opinions than fact. And I understand that, but when you put out opinions instead of fact, you weaken your argument. One of my concerns, unfortunately, I've had a lot of involvement, not near as much as you guys, with this. I know several people, their threshold is, I don't use needles, I don't use needles. And to make it more easier for them to use needles is not a good thing, because the two I know that don't use needles are still alive. Well, the others, one suicide and one OD'd. So I don't like it for that reason. And now I'd like to mention that timing's wonderful. The semi-botched pre-rollout of this. Again, don't try to change the law, and I'm sure it wasn't intentional. I really wish the commissioners would have heard about this. I wish the state's attorney would have heard about this. We've had two things in the last few weeks where people have put out information and said, don't share this. Both of them made it to the Carroll County Times. So in the future, that's probably not a good strategy. But you can't change the law. And unfortunately, for me, my first month as a commissioner showed that there was some way misunderstanding in state law. The Attorney General cracked staff all over the place, led to the opinion piece that elected officials shouldn't talk about it, even though they're the only ones in the room that were right. Sometimes us elected officials are stupid. Sometimes even a blind hog finds an acorn once in a while. So that was sad that the defense of that was to lie. And of course, I haven't read the Carroll County Times, so I can't tell you what was in there, whether it was right or not, but I understand it's two pieces in there. But one of the things I truly love about Carroll County, and I love about you guys 90% of the time, I love about me 50-50, we talk to each other. We communicate with each other. When the governor came up and was so amazed the response to all the wires down, one of the things I said, the state police, the sheriff, everybody talks to each other. Nobody had to go, oh, hi, I'm the sheriff, you know. We talk to each other, and it's very disappointing to me. Whether this is positive or negative, it's got a negative light now because evidently the law was poorly explained without law people there, and that's a shame. That's a bad way to start. And like I say, again, in my humble opinion, and I saw this through past COVID, whatever, opinions getting put out as fact, and it hurt all of us. And I like COVID, we're learning about this. Like you say, it's been going on for hundreds of years, but we're still learning about it. But when we start putting opinions ahead of facts, we weaken our argument. Thank you.
Yeah, thank you.
Can I
Yeah.
Can I just say thank you for sharing your personal information? That's,
Yeah.
Thank you.
Yeah, and I wanted to keep personal away from Commissioner because, like I say, that's what scares me about the needles is them being too available. And like I said, Baltimore City's probably done this since before 2000, and so far it ain't helped a damn thing. You know, and hopefully, you know, I understand, and your questions got me thinking too. You know, it's tough, and the analogy to sexual activity is very similar. You can't put people in a bubble and think they're gonna deal with life when they get out. I know we didn't always do the best, but I felt good when our kids were away at college because I felt like they had seen enough that hopefully, you know, one of my buddies, and this applies to this stuff, his thing is you protect them as much as you can until they're old enough to make their own decisions, which for some people that's 70, for some people that's 15, and it's hard. So, yes.
It is.
And I can't speak to what was said from the meeting that our staff had with one law enforcement agency. I can't speak to how that was carried forward, whether it was the intent of what they communicated or not the intent of what they communicated. I wasn't there, so, and none of them were there to speak for themselves and say, no, that our intent, Because
I-
as a part of applying for this program, there were certain criteria we had to do, and my conversation yesterday included that, it was 3 weeks ago I sent our agenda, this was on the agenda to be spoken about, and that we had been working through individual meetings with each municipality, with each law enforcement agency, and scheduling them. What we weren't getting was those return phone calls to schedule them. And our intent was to try to meet with everybody individually to hear their individual concerns, rather than get a room of 25 people together and it all gets blurred.
I understand.
Because it does become very blurred. If you have something, an issue with something here in this particular municipality, and we can address that and move stuff forward, then that's fine. But if we get in a room with 25 people, it's very difficult to tease out what issues are really the problem, because then everybody starts feeding off of each other, and we really don't get to, what are your concerns, what are your, as a part of this, and I saw the spreadsheet, it said, have you met with law enforcement? We checked no, and my question to staff were, that's a part of this process, we need to get these things booked.
Yep.
So, as I said, that was secondhand information that was taken to an entirely different group, and we've not been permitted to say what was said or not said, because we don't know.
Yep, and hindsight's wonderful.
It
And-
is.
And back to the agenda for today, and Roberta, holler if it's just my stupidity. We see the agenda. We see 2 pages maybe. We saw the slides this morning. So.
I understand.
Yeah, I heard this morning that this was gonna be on the agenda, and I thought, well, that timing's great, but you guys planned it, like you say, weeks ago.
We
But
probably
we
planned it
didn't
2
know
months
that.
ago, but.
Yeah, we didn't
To make
know
sure
that.
that we were ahead of it, but, other things happened.
And Board of Health
late
meets,
plans.
twice a year, so,
And we could have come before you.
that's a
ahead of
good
time.
reason
It is
why
a
it's
good
not 15 minutes,
opportunity.
it's 2 hours, because we only do it twice a year, but, it's, yeah.
And then to your point, I have a copy of the agenda that was sent to us, but it really wasn't specific. You just said in general, harm reduction efforts. And so we
Yeah.
don't quite know what's going to be talked about unless you
Yeah.
explicitly tell us this is what we want
I
to talk
understand.
about.
Right. And again, just to clarify and reiterate, we have not started a syringe services program at this time. So we were in the stages, as Sue just said, of notifying all of the players, and that would have included the state's attorney's office and the public defender's
And we
office.
do know that these efforts are going on already in Carroll County. I mean, it was mentioned at the town hall meeting that Roberta and Commissioner Rothstein were at, that somebody from the community came in and said, I live and work in Frederick County, but I come into Carroll County to do these things because they're needed services. And what we're trying to do is put that under the umbrella of us, that we know what's going on in Carroll County.
So I don't remember that, but that's okay. I just don't remember that.
That's
But
okay.
going back to what you shared, so this one of 4 services is currently not being conducted in Carroll
Correct.
County.
Correct.
Is there an intent for this, or one of 5, I guess, services to be conducted in Carroll County?
There is, yes.
When do we expect, as you walk the dog through all the municipalities, through the state's attorneys, through all the checks and balances necessary for this program to be in place?
Yeah. So we're pretty flexible at this point
Okay.
because we want
Okay.
to have these conversations with
Absolutely.
everybody. So there's flexibility with it. And I want to get back to, I'm not sure if Commissioner Kyler, I think you mentioned that these bullets without data and without facts or opinion, we had really prepared to give you an overview of harm reduction. We hadn't prepared to give a data-driven presentation today. But we would love to do that for you, and we would love to invite you to meet with us so that we can do that for you.
Yeah, and like I say, it's some of it's opinions, and whatever happened, whoever talked to law enforcement and misadvised them on the law, that's unfortunate. And like I say, hindsight's wonderful. What I've heard from the state's attorney is nobody ever contacted them, and who knows if that's true or not. And it's a shame, and it taints everything moving forward. But, and I don't think.
Gonna make it harder.
I don't think you did it intentionally, but
Absolutely not.
it happened.
Right. And I want to be clear, too, that the law isn't coming from us. This is a state legislation and not our interpretation of law. It's the AG's interpretation of the law. So I want to be clear
And the
about
last
that.
time I heard that from the health department, the AG sent us a 3-4 page letter saying, you were wrong, you were wrong, you were wrong. So I've no offense, but I've got to lean with the state's attorney's opinion
I
on what
hear
the
you,
law
and
is.
certainly don't want to get in the middle of
Yeah,
that.
yeah.
That's, I
if-
don't want to
and-
step in
yeah,
something
you
new.
know,
Yeah.
and like
Not
I
our
say,
goal.
it's happened quickly. Maybe they're mistaken too, but, and as we are up here, it's a fine line between questions on, are you condoning the use of drugs or are you limiting, you know, and you guys know that better than we do. It's a fine line.
You're,
And I'm totally selfish. In my household, I want my parents and me to my kids and whatever, you know, there's mindsets going on now that certain things should be kept secret from parents. Well, I don't go by that at all. And then one of the things you said today that I think is very, very true, again, my limited experience, these people with serious drug problems were molested as a 6-year-old, they were abused as a whatever, and I get concerned, and I've brought that up at recovery houses, unless you address that, you're probably not gonna fix the other problem, because it's a symptom. And it's hard. And again, back to all of this, I know adults that bought drugs in a recovery house, and both the person selling and the person buying were thrown out, you know? So again, when do we help and when do we say, you're not my problem anymore? It's tough.
Right, and so, again, you know, we're not, we're making sure that people can get to a point that they can get to services when they want them. And these are also folks who maybe aren't coming in for services, generally speaking. So they're out there not accessing services. It gives us another opportunity to work with them and say, we're going to meet with you where you are right now in your readiness for change, but let's move the needle on that readiness. Let's really work with you on addressing those harms, on addressing the trauma, on addressing the wreckage in your life from substance use. But let's get you to a point where you're living so that we can do those things, because they don't happen overnight.
And what you guys do, I mean, environmental first, you enforce rules. So there's a lot of people that don't like you. And in this, it goes back and forth, and you do a lot of things that seem somewhat controversial.
Well, behavioral health is very unique. That's what I can say. And we can't treat anybody who doesn't want to be treated. We're not allowed. We can't force anybody into treatment who doesn't want it. So we have a softer touch and a softer approach to get there.
the legislation, which kind of leads into my question, with the 5 categories, it is an enabler. It allows you to put these programs in place. It is not directing you that you will, by this date, have these programs
Correct.
in place. Is that
That's
a correct
correct.
statement? Okay, so with that said, what I'm trying to gather, you know, from, you know, your expertise is that you are putting in place those programs within the harm reduction strategy that are ready to be put in place. And at this time, this syringe service program you are developing to get to a point to then put in place. So there's legislation, that's state legislation, that's out there to enable us to do this. Not all counties are equal. Not all counties are doing the same at the same rate or the same pace. So I do appreciate you looking at surrounding jurisdictions, because drugs don't have boundaries. And just knowing that and the conversations you're having with our law enforcement is critical, I believe, which includes all of law enforcement.
Correct.
Okay, yeah, I would like, as we move forward, you know, and as you move forward, that we understand that this program is, you know, part of the strategy that will now be enacted, you know, across the county. And some things, you know, I don't want to disagree with Commissioner Kyler, although I do
I
sometimes.
thought you always agree with me, Dan.
No. But there's some things that are subjective. But there's some things that they're not subjective, like decreased drug use. You can count that. You could figure that out. But it's very difficult to actually, I guess, qualify, make the specific numbers. That's the challenge that you have with a lot of this is show exactly the impact that it has. That's why I'm always about task, objective, end state. So the more you can describe that, I think the better we are, and also the better the community is, you know, as well as understanding these programs, because nobody knows Carroll County better than Carroll Countyans, and if this program is designed to make us a healthier quality of life for Carroll County, then, you know, I'm looking forward to seeing where it goes. It may not be fully enacted, you know, at a decision made, but whatever we can do to reduce harm, you know, and make a better community, then, I mean, I just believe we're all for it. So,
The
yeah.
opioid epidemic has
and I
been
think,
extremely difficult
It's horrible.
to get on the other side of.
It is horrible to get to the left side of that boom, and I mean, yeah, and it's not getting easier, you know.
And my last comment, because we often disagree, which is good, and so do all five of us. I understand objective and subjective, but I also fully understand a positive correlation rarely proves cause and effect.
Yeah.
And it takes a lot to prove cause and effect. Now, we've talked a bunch, guys.
Well, so we've got to acknowledge up here that you are all the healthcare professionals. You're the healthcare professionals in the county. So the advocate, and I'm talking specifically about the syringe service program. I don't think, I can't speak for the board, but no issues with the other harm reduction strategies. But in terms of syringe service program, I mean, the advocates for this program will say it works. A quick look online says that the data isn't unanimous by any means, but as you know, as healthcare professionals, you're doing your job and you're making the recommendations. But from a policy standpoint, it's also easy to look out into the country and see where different municipalities, different states have decided that this syringe reduction or replacement programs, if you want to call it that, do not work for them. And from a policy standpoint, whether that's public policy or health policy, I'm not convinced that it's a good idea. And I'm certainly not convinced it's a good idea for Carroll County. If this syringe issue is going to be coming before the board at some point for us to make a decision, and I'm not really sure if that's exactly where we're headed with this, but if it's something that the five of us are going to be ruling on, I'm certainly a no. I just need you to be aware of that right now. But I do appreciate the other things.
Thank you.
So I just wanted to add clarity to that because people are listening, people are watching. The press on these types of programs is typically not good. You don't hear the good things, you hear the bad things. But I can say just from my personal standpoint, it's not something I'm gonna support if I have the opportunity to roll on it.
Well, I'll be exceptionally brief today. I know everybody else has pretty much covered it. I guess my biggest concern the last couple of days, which was mentioned earlier, was the paper. Not going to blame anybody. I mean, sometimes the media gets it wrong, sometimes we get it wrong. But I think the one thing we need to collectively do is we all need to work better together. So whether that's interfacing farther out in advance, and, you know, because that's what we do well in this county, and that's what I think is most important. I'm not even going to get into my opinions one way or the other on that at this point. There's a lot of different information out there. I do appreciate everybody coming in this morning. I know you've got a little bit more I think you're going to cover, but I
Yeah, we're
just
just
wanted to
doing our
point out, I
best.
do appreciate all the time and hard work that goes into everything.
And not opinion, and I said I wouldn't speak again, but you have offered to meet the 5 commissioners once a month, and we've talked about it, and I think we're safe. If we're invited to meet you, the quorum doesn't matter, and we're not gonna do any policy there. So, again,
Well, we'll get together
we
and
should have
figure
maybe
out
done it
best
a year
days
ago,
and times.
but let's not avoid starting it. And maybe one of us will come, or 5 of us will come, but it's gotta be worth doing. So that has been offered on the communication.
Thank you for your feedback, commissioners. We're just going to wrap up.
Yes.
This is just brief history of harm reduction programs, so you can see where they've gone back from 1967. As Adrienne likes to tell me, that was before she was born, but it was also before I was born, so.
Yes, and as evidenced by the gray hair, that was not really recent.
That's right. So, these programs have been going on for a very long time, just much more recently here in Maryland. And then the next slide, I think, is probably our last slide. So, Adrienne.
it's not.
Oh, it's not? Okay.
It's not.
We've already kind of talked about some of this, about the law and the Health General article, so
Which we can,
we won't want to belabor it.
Next one?
But we have a lot of evidence, certainly. And I think on any topic that you want to search, you can find pros and cons, you can find people for and people against. Some topics that would surprise you, honestly, that you would think everyone would be against. There are
for.
groups out there who are all in. But there's definitely a lot of research. And history. Like I said, these programs have been around since the 1960s. So there is a lot of information out there.
That's just
That's our team.
team.
That's just our team.
Harm reduction team. So we just welcome meeting with you guys, giving you more information and the data that you're seeking, and we appreciate your listening and your feedback and your honest opinions, because it's good to have this kind of discourse. We need everybody's opinion in the room, and we appreciate again the time you gave us today. Thank you.
Thank you.
And one more, if you can do a quick commercial, the opioid coalition meeting, because one of the things I'm impressed with there is you guys take a stand on some things that aren't the popular stand, aren't the liberal or the conservative stand, but a lot of information gets put out there, and I don't know how open you can be on other people coming, but
That's
it is
Amy,
a
our
great-
colleague Amy L.
Yeah,
is
it's a great
heads-
opportunity
yeah.
to hear from a lot of
She heads
people in the
that.
community.
It is, and I think it's really important to say that what we do is it spans the spectrum. So Amy's group does all the prevention, and then we go for the people who we couldn't prevent from getting into addiction or serious mental health disorders. That's where we kind of come in the harm reduction. So we're trying to do something for everybody, basically. I'm going to turn it back over to them, let them address that. And again, thank you.
Thank you.
Hi, I'm Brooke Fox. I'm the Opioid and Suicide Prevention Program Coordinator with the Carroll County Health Department. I just wanted to give an update. The next Opioid Prevention Coalition is Wednesday, November 13th. It's 9 a.m. to 11 a.m. at the Health Department. And we hold that every second Wednesday bi-monthly.
And
Yes,
November
and we do
thir-
provide breakfast.
November
Bagels.
13th happens to be a wild day. That's when PSEG's coming. There's many things going on that day. So, but yes, this is a great, and 2 hours maybe?
2
It
hours,
lasts?
9 to 11.
Yep.
Yep.
And
I'll
it
just-
normally lasts it.
Yes, and I'll just echo what Amy Baker said. We're also always happy to meet with you guys and answer any questions you have about any of the prevention programs.
Sounds good.
Well, last effort. And this
Thank you.
one should be short also.
Thank you.
so.
Thank you.
I don't know whether this is good time. Oh, I guess, do I need a motion? Oh, we're not done.
We're
quite.
not
You
done.
got one more thing and it's quick.
Okay,
Very
okay.
quick.
I thought that
She might be
that
able
was-
to do it faster
that was
than
the
me.
end.
Good afternoon.
Good afternoon.
My name is Cindy Dotter, and I'm the program supervisor for our Health on Wheels mobile clinic program. And Lisa Rock is our assistant director of nursing. She is my counterpart with this program. We introduced this program last year. I know Commissioner Gordon, you were able to attend our ribbon cutting ceremony. This is a picture of our vehicle that was present for touring that day. We have developed a purpose statement not to, yes, sir.
Is this the vehicle that requires a CDL driver?
It
Oh,
is.
okay, okay.
It
I thought it
certainly
had to
is.
be.
The one and only.
Can I
ahead,
just share
sorry.
with you? You live, you learn. The first vehicle we bought did not require a CDL driver.
Absolutely.
Apparently, whoever bought this one did not look at the specs.
We were close. We were very close to the weight for this. But so we developed with this program not to supersede what our mission and vision were for the health department, but a purpose for this program for the mobile services. So we want to promote health equity. So that is a hot topic. We know that we want to make our services available to everyone in our community. So we like to look at this as bringing direct services and wellness opportunities that we have at the health department and taking this out into the community with the support of our collaborating partners. So we do have a few goals. We want to develop and secure partnerships with the community agencies and organizations to promote our events and services and developing a rotating schedule. We deliver clinical and wellness services throughout all areas of the county, especially to those that face transportation challenges, which can be a challenge, again, for some of those communities such as Tawnytown, Manchester, Union Bridge. So we're looking to really target those areas. We promote community engagement by communicating with our partners and evaluating the services and events after we have them. This next slide are just some of the agencies and partners that we have the MOAs with. We do right now have a large presence at the public libraries. This past year, without having a CDL driver, we found that we needed to be able to provide services indoors or in areas that could support any indoor services. The libraries that are a hub for our cooling centers and as well as our warming centers, we find a lot of the population we're trying to reach do frequent those facilities. So they have been very engaging partners with us as well as everyone else on this list.
Well, what about the community college or the schools? CCPS or the community college?
CCPS, we are present in the school system with a lot of different health fairs and things. They are definitely something that we're looking to partner potentially with for their back-to-school nights or their PTA nights, where we can look at the families, not just the children, that we can reach a large target as well.
And
Absolutely.
community college?
Absolutely. They're on our radar to try to coordinate with. We are with McDaniel College
Yeah, I saw
already.
that.
Yes, so we do take some of our clinical services there as well. So definitely our program is growing. We are looking to build a lot of our partners and get them on that rotating schedule.
Great.
Absolutely. So some of the services we have been currently offering include the blood pressure screenings, a lot of health education and information. We do provide topics that are relevant to the time of year, sun safety, bike helmet safety. We look at tick-borne illnesses, rabies prevention. Right now, we're looking at respiratory illness, hand hygiene, things that we can really target that information and get that out to the community. And this is, I do want to remind everyone, this is a health department-wide program. It's not, I'm with the Community Health Services Bureau, but we touch every bureau at the health department, so we do like to incorporate services from each one of those bureaus as well. So we do HIV and Hep C testing on site. We are currently taking the influenza vaccines out for adults. Naloxone training and distribution, we do have that on each and every one of our events. We have Bureau of Prevention, Wellness, and Recovery staff, the peer support staff that are on each one of our events. They do have a dedicated peer that is assigned to us. as well as a nurse that is out with each one of these events. We're all trained for naloxone, that we can provide that in the communities as well. Some of the other services are dependent on staff availability for oral cancer screening. We did speak to the peer support services, reproductive health services, STI testing, and smoking cessation. That's where we focused our past year's services. We do plan to expand the adult immunization. We know there's been an increase in pertussis in the communities, so we're hoping to bring out some vaccines, maybe some Tdap and things of that nature. Hoping to bring birth and death certificates out. We're working through a couple technical issues with that process. Cancer screening programs, looking to also bring children's immunization, looking at targets, again, Tawnytown, Union Bridge, the areas where the parents may have a little difficulty bringing those children to us. We want to take our services to them. Also looking to incorporate some WIC, the Women, Infants, and Children's appointments, again, to those targeted areas to try to make it easier for those families to obtain the services that they need to have. So this next slide briefly, it's just a snapshot of our first year. This has definitely been something that we're looking at what has worked, what hasn't worked. We also know we have not had the vehicle available for a lot of these services, so we're really hoping this next year when we can present those totals, they're going to be a lot different. But you can see that we did serve about 400 Carroll County residents in our services. So just looking at the first quarter alone, we have already increased our attendance. So we are really hoping to build with that. We can announce to you that we have hired a dedicated driver for our program. We're very, very excited. He brings a lot of experience in transportation and coordination with us, as well as a very solid safety background. So we're very excited to have him. He just joined us about a month ago. So that is something that we're hoping to build on. So looking forward, we're looking to add partnerships with food pantries and food distribution sites, the soup kitchens, and shelters and areas where there are identified areas of clients without housing, so that, again, we can make them aware and have our services available to them where they are. We're looking to enhance the partnerships that we have, again, to focus on services and identified needs, working with community partners. I try to tailor services to what they want for their community or for their establishment. Adding those WIC and children immunization clinics in areas where we've identified that participation and compliance may be not where we really want them to be. And increasing the education about vaccine preventable illnesses. Again, pertussis and so forth. We really want to make that available out in the community where there's a need. Community engagement, that's my last huge piece, though. We really need to engage a lot of other entities and build a little excitement about what we can do. Let's look for things that we haven't done already. Can we partner with someone to bring those services to that area? So we are hoping to have another open house so that our community partners can come out and tour the vehicle and come and meet our driver and staff, and let's talk about what we can do for you. And lastly, we do have a QR code that we are in the process of having a small just card that we can hand out in the communities when our peers go out into the community and they're reaching that population that may not have access to our social media platform and so forth, but they can get to a library. They have access with a smartphone. Scan the QR code that takes them to our calendar on our website, and they can see where we're going to be. So if they have a need, they can hopefully be able to make it to one of those sites. And lastly, we, again, have taken the vehicle out a couple of times already. One was to the Finksburg Library and the other to the Tawnytown Library. And just wanted to show you a little bit of the setup as we have that out. And that's all I have.
You always get stuff first, huh?
I guess so. I guess we rank a little bit above Manchester.
The original intent
Thank you.
of the vehicle
Thank you.
was to get to medically desert areas and identified there as Manchester, Hampstead, Tawnytown area, Union Bridge, areas where there's not a lot of primary care facilities or dentist or behavioral health programs, and they have a harder time, and they have, especially the Tawnytown detour area,
Yes.
have a challenge with internet reception. So we also have programs, much like the program that gave away computers with the county, but we also have programs specifically to behavioral health where we're able to get somebody a smartphone and a booster if they need it to participate in behavioral health programming when transportation's the challenge or things like that. So, and then there's one other program that gives tablets to kids for mental health appointments, so that we're trying to remove those barriers of transportation. Is that issue? And
I
that is-
respect that. I respect that.
You've got to be able to figure out how to get to the people if the people can't get to you.
I know for a while, when I served on the city council in Tawnytown, Mission of Mercy used to come through town, I think quarterly or something, with a medical services truck. And I have not seen them around in a while. It doesn't mean that they're not there. I just haven't seen them. So to know that we are doing this is really awesome. So thank you for that.
An hour later.
Thank you. And
We'll
thank you,
try.
everyone, for coming, and
Maybe we can talk about
good.
at one of our meetings how we can rectify this, but because there's a lot of good information
Yes.
that people should get to know about and be able to hear and make available to them. Thank you all.
Thank you.
If it was easy, anybody would do it, but you guys are, so thank you. Now, we need a motion to adjourn the Board of Health
Motion.
meeting?
It's a motion to adjourn as Board of Health
And restart as the Board of County Commissioners.
And come out of recess for the open.
Motion to adjourn recess as Board of Health and return to, all right, hang on.
Open session.
Motion to
Open session.
adjourn.
Motion to ad-
Board of Health and
Come out of-
restart as the Board of County Commissioners.
Motion to adjourn as Board of Health and restart as Board of County Commissioners.
Second.
Yeah. Have a motion and a second. All those in favor?
Aye.
Opposed? Thank you. Yes, yes, we got it. We got through it. Now, you're going to make us all ethical, correct?
I was about to say good morning. I got it.
Yeah.
Wow. Good afternoon, Commissioners. This is a follow-up to our public hearing, which we held on October the 17th. We decided to leave the record open. The public hearing concerned the adoption of, possible adoption of some amendments to our ethics code that are required by state law. Just quickly, by way of background, in 2021, the state amended the state ethics law. All counties and municipalities are required by state law to have the same or stricter provisions in our ethics code. So we needed to add 3 provisions to comply with that directive. First one prevents you from using confidential information obtained while you're in office for your own benefit, other than in the discharge of your own duties. In other words, if you discover something that maybe it would benefit you, but at the same time, there's a legitimate public purpose in disclosing the information, you're allowed to do that. The second one provides some additional protections for ethics whistleblowers. Currently, they are protected from you. This would add also them being protected from me, managers or their employers as well. Finally, the now famous MACO provision requires you to report any gifts in excess of $20 from a MACO or MML type organization in a calendar year, or up to 100 in a calendar year in a series of 20s.
Were there any comments while it was left open?
No.
Motion to adopt the amendments to Chapter 34 Ethics.
Second.
I have a motion and a second. Any further questions or discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you. Seems like that we've been talking about that for a long time, doesn't it?
Yes. Now we're going to get an update on the first quarter of our budget update.
Good afternoon.
So these first quarter updates are generally not terribly valuable because it's just a lot more we don't know than do know at this point, but this is just a way to kind of keep you with us as the year develops. So with current projections for revenues and expenditures, we believe we'll end the year with $9.7 million left over in the budget. And again, going back to the lot more we don't know than we do know, that can still change a lot. We plan to carry over every year 1%, which would be about $5 million, leaving about 4.7 of projected unassigned fund balance from 25. Now look at the revenue side, property tax. We do have the tax levy in. The state sends us all the information. We believe we'll be up about $3 million over. Of course, $3 million is a lot of money, but that's $3 million over $260 million. So percent-wise, it's nothing terribly interesting. Do need to point out there, though, that there can be appeals to assessments, which can change this. Occasionally, a mistake is found somewhere, but this is a number we could be reasonably comfortable with. Income tax, for the moment, we're just saying on budget, we have very little information at this point. We've gotten 2 or 3 small distributions, but we don't get our first significant one until the end of November. Recordation, right now we're projecting $2 million below budget. We have 2 things going on here. Now, one is we raised the recordation rate, which upped our projection. But as we talked about in the last process, we went through a unusually strong few years of recordation collections. We knew that that was slowing down. The trick is figuring out how fast is it slowing down and how far is it going to go. So after just 2 months of collections, we have seen it slow enough to say $2 million below budget. But this is another one. In any 1 month, we can see a change in what's happening out there. And I actually just recently saw 2 newspaper articles. One was a national article talking about a very significant slowdown in house sales across the nation. I think it was 15% or something like that. But then a couple days later, there was an article very specific to Carroll County, which had us up about 15% in sales. Yeah, so it's hard to know. Rest of the revenues, really not a whole lot of interesting information to share there. So in total, right now, we figure we're up about $3.3 million on our revenue projection. On underspending the budget, we're figuring about $6.5 million. The biggest part of that is the reserve for contingencies. Of course, if something comes up that we're not planning on, that'll change that number, but 2/3 of that unexpended would be not using the reserve. And the biggest part of the rest of it would be open positions. So we went into 24 with an unassigned fund balance of about $45 million. During the last budget process, we used $32.5 million, leaving us with a little bit over 12. Then out of 24 operations, we have a new approximately $17 million. We're estimating right now about $4.5 million from 25. If this all plays out just as we've talked today, that would leave you with a little under $34 million of unassigned fund balance at the end of 25.
What did we have unassigned at the end of 24?
12.2.
Yep.
Right.
Say again?
12.2.
12.2. Okay.
So
Didn't even see your lips move there, Ted. That was good.
Does anybody have any prediction on income tax? I mean, it's too early to say the money is proving something, but are we hearing that that's going to be down, that's going to be up, or nobody knows?
there's really nothing to go off on this point. Now, the state is seeing the money coming in. Again, it's one of those things where they don't know who the money belongs to. So even if they were going to share that information, they don't know what to share at this point. It's like at the end of November, we'll get the first quarterly distribution. We are already talking across the state and with the state about getting together to talk about what we see out of that. So I'm hopeful in early December we will have a conversation. And then there's a similar meeting every January where we get together to talk about revenues. And we usually have the director of SDAT come in and a representative from the comptroller's office. We kind of talk about what they're seeing, and we also talk to each other about what we're experiencing in the counties. And again, that doesn't get us to answers. It just gives us a little greater context for what's going on beyond just what we're seeing.
And Ted, could you email all this to us when you have a chance? Because I tried to take notes, but I just want to make sure I've got everything correct.
Yes, I can do that.
Thank you very much.
Any questions, comments? Thank you.
Thank you.
Thank you.
Thank you.
Next, additional payment for workman's comp insurance for fire and EMS employees.
I wondered where you were running off to.
Good afternoon.
Good afternoon.
The Office of Procurement, in cooperation with Risk Management, requests your approval to grant the spending authority for payment to Chesapeake Employers Insurance Company for workers' compensation insurance coverage for the fire and EMS county employees in the amount of $698,082. This amount will cover the adjusted amount of the fiscal year 24 billing and the current fiscal year 25 estimated rate. These amounts are in addition to the renewal of the current policy that was previously approved by the board in July of this year. The calculation is based on a dollar amount which are tied to job classification codes. The funds are approved in the FY25 budget.
Since this is estimated payroll and actually salaries paid, the slower hiring in this, has that reduced this number or really doesn't affect it yet?
It won't affect it yet. We will get another invoice July of next year. So that's, we're paying, this is part of the audit from 2024 or FY24. And then, so the difference will be picked up then. So if we have less payroll, it's based on actual payroll at the end of the year. So we do a preliminary, which is part of this, and then the actual.
Motion to approve the additional payment for workers' compensation insurance coverage for fire and EMS employees to Chesapeake Employers Insurance in the amount of $698,082.
Second.
Have a motion, a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thanks.
Thank you.
Thank you.
Now, cloud annual support from IT.
Good afternoon.
Or afternoon, actually.
Good afternoon.
Good afternoon.
And I gotta thank you guys. I now have a new laptop, and I don't think I damaged the other one, but I'll be very careful with it.
The rock to it.
The Office of Procurement, in cooperation with the Department of Technology Services, requests your approval to renew the contract with MCCI for Laserfish Managed Cloud Annual Support in the amount of $75,350. The amount is within the FY25 budget.
So, and basically all this is it's our electronic document archiving system that we've had in place for many, many years, used by quite a few of the agencies. And it allows us to get stuff off of our system that's no longer currently being used, but needs to be kept for future possible reference.
Motion to renew the contract with MCCI for Laserfish Managed cloud annual support in the amount of $75,350.
I'll second that.
I have a motion and a second. Any further discussion, questions? All those in favor?
Aye.
Opposed? Thank you.
Thank you. Have a great afternoon.
You too.
Energy Efficiency Block Grant Allocation. You get to make this motion, so.
You're here
Good afternoon,
alone,
Commissioners.
I'm afraid.
Yeah, I got a little support back there. Commissioners, we're here to discuss application and grant acceptance for the Department of Energy's Efficiency and Conservation Block Grant. This program was created underneath the bipartisan infrastructure law with local governments to implement strategies to reduce energy use and improve energy efficiency. There's a one-time allocation of $80,670 available for Carroll County through this program. The Department of Public Works will use this funding to develop a conservation strategy for the county and using Department of Energy's technical assistance. So just to provide a bit more information, this is a follow-up from our presentation last year when we were seeking direction on a countywide energy management program. Since then, we've begun the process to purchase 3 electrical vehicles and 2 charging stations through the FTA's carbon reduction program. I am now a representative on Baltimore Metropolitan Committee's Renewable Energy Subcommittee. And we've also begun an internal energy work group that includes staff from Public Works, Planning, Land Management, and the Comptroller's Office. So during this next phase, we plan on using this funding to identify opportunities to reduce energy use and waste, switch energy sources, anticipate increased energy needs and associated infrastructure required, improve resiliency, all with the overarching goal of saving money for the citizens of Carroll County. With your support, Public Works will lead this effort by working with the Department of Energy, who will match us with a consultant whose expertise aligns with the goals of Carroll County to establish an energy plan. So, happy to answer any questions you have on this.
Is this money for a consultant?
So there's a wide array of options we can use this money for. One of them is a consultant to provide advice on an energy plan.
But it is, I mean, you have other choices.
Yes.
You could, okay.
We can also use for equipment, any HVAC equipment that is reducing it. It's almost like a voucher payment program is the route we're taking through this.
Motion to accept Energy Efficiency Block Grant EEBG allocation.
Second.
I have a motion and a second. Any further discussion or questions? All those in favor?
Aye.
Opposed? Thank you.
Thanks so much. Appreciate it.
Thank you.
Now, approval to purchase a Chrysler Voyager and 8 Ford F-Series trucks.
8 of them.
Good afternoon, gentlemen.
Good afternoon.
Good afternoon. They're not getting cheaper, are they?
Unfortunately, no. The Office of Procurement, in cooperation with the Bureau of Fleet Management and Warehouse Operation, requests your approval to purchase 1 2025 Chrysler Voyager and 8 Ford F-Series trucks from Hertrick Fleet Services in the amount of $650,606. This purchase will be made from a Howard County contract that Carroll County will utilize. This amount is within the FY25 approved budget.
Motion to approve the purchase of 1 2025 Chrysler Voyager and 8 Ford F-Series trucks from Hertrick Fleet Services Incorporated in the amount of $650,606.
Second.
I have a motion and a second. Any questions or discussion? All those in favor?
Aye.
Opposed? Thank you.
All right. The Office of Procurement, in cooperation with the Bureau of Fleet Management and Warehouse Operations, request your approval to purchase 1 Ford F-550 4x4 Ultra Medic ambulance from Atlantic Emergency Solutions for Fire EMS in the amount of $393,283. This purchase will be made utilizing a Sourcewell contract which was competitively bid. This amount is within the FY25 approved budget.
Now,
Full
is
inside
this?
and outside?
Oh, I'm sorry.
I was just gonna say, is this inside, outside?
Yes, sir. So,
That's what I was gonna ask.
yep, again, from a fleet perspective, this is a complete unit, so it includes graphics, lights, communication equipment, everything. Chief Robinson and his staff will be in front of you at a later date requesting some additional
medical and specific equipment that goes inside the ambulance. But yes, from a fleet perspective, it's a complete unit.
Did you test drive it?
Motion to approve the purchase of one Ford F-550 4x4 Ultra Medic ambulance from Atlantic Emergency Solutions for the Fire and EMS Department in the amount of $393,283.
Second.
Any discussion or questions? All those in favor? Aye. Opposed? Thank you.
Thank you.
Now, contract award installation of water service conduit and lateral under Maryland 32.
Good day, gentlemen.
Good day.
The Office of Procurement, in cooperation with the Bureau of Utilities, requests your approval to award a contract for the installation of a water service conduit and lateral under Maryland Route 32 in Commissioner District 5 to HDI Contractors of Sykesville, Maryland, in the amount of $47,530. This award will be made via a competitively bid term contract. The bid amount is within the adopted budget.
Gentlemen, this is a very straightforward project. The properties have been offline for a number of years now. The service lateral has several leaks in it. The properties are being redeveloped now, and they're in need of water service. So the water main is on one side of 32. The properties are on the other side of 32. We have to get the service lateral beneath Route 32. And
Where on 32 are we talking?
just south of the intersection of Liberty Road, maybe a quarter of a mile or so.
Okay, okay.
The most efficient way of getting that service lateral is to drill beneath the road, and even with that drilling operation, the cost is still quite high. If we were to open cut the road, the cost would be near $100,000. So.
I'll move the Commissioner's award contract for the installation of water service conduit and lateral under Maryland Route 32 to HTI Contractors in the amount of $47,530.
Second.
I have a motion and a second. Any discussion or questions? All those in favor?
Aye.
Aye.
Opposed? Thank you.
Thank you.
Thank you.
Thank you.
Now we're going to talk about purchase of land for the Carroll County Regional Airport runway safety enhancement project. And these are like permanent grading easements, right?
Yes.
Yeah. Huh. Wow.
Good afternoon, Commissioners.
Good afternoon.
Good afternoon.
Department of Public Works is requesting your approval to purchase a portion of the land in the easement at 517 Vision Way Drive, Westminster, Maryland 21157. This is containing 0.2311 of an acre of land, more or less, fee simple, and 0.0529 of an acre of land for a permanent grading easement, for a total of $5,670. The County Commissioners have advertised its intent to purchase this property. The land is being purchased in connection with the Carroll County Regional Airport runway and taxiway relocation and safety enhancements project. The FAA will reimburse the county 90%, which is $5,103. The MAA will reimburse the county 5%, which is $283.50, and the county will pay 5%, again, $283.50. And I apologize, I did not get the recommended motion changed like you had requested. But moving forward, I'll make sure that the county's portion will be in that recommended motion.
No, it's all good. Appreciate that.
Yep. I move the Board of County Commissioners approve the purchase of land and easement at 517 Vision Way for the amount of $5,670.
Second.
I have a motion and a second. Any further discussion? All those in favor?
Aye.
Aye.
Opposed?
And the next one's the same thing, just for
Yeah, another
F0
easement.
509 Vision Way,
509.
correct?
It's similar, larger, fee simple, I think a smaller grading easement.
Okay. I move the Board of County Commissioners approve the purchase of land and easement at 509 Vision Way for $7,690.
Second.
I have a motion and a second. Any discussion or questions? All those in favor?
Aye.
Aye.
Thank you.
Cool.
Thank you.
Thank you.
We have a caller.
That's correct, sir. Caller, if you could use *6 to unmute, you'll have 3 minutes to make public comment this afternoon. Please identify yourself.
Yes, good afternoon. Catherine Adelaide, Chair of Election Integrity for Carroll County Republican Central Committee. I might have actually been as busy as you guys this past week because you didn't hear from me last week because it started early voting. I was there about 5 a.m. to get a great spot for the Republican Party electioneers. It's been really, really exciting, crazy busy. I think I've been up at 4 o'clock every morning for the past week. I want to thank our chair, Joe Lehman, member Kathy Allison for being at the trailer all these weeks. This Saturday is the last day for the trailer from 10 to 1. We're still selling signs and lots of Trump gear. It's like a Trump rally out there. It's really a lot of fun. Thanks to Krista Schultz, our member, for covering our social media with the election information. Rich Collins put up a large sign that unfortunately was vandalized and knocked down. He came back out and put it up again, the big Trump sign out at the Senior Center. I've been at the Westminster Senior Center all week because that's where we're getting the most votes. Scott Hollenbeck's been out there, Mercedes Mobus, Karen Leatherwood, all worked hard on our Carroll County Voters Guide and Palm Card, and all the candidates, including Sam Jones, worked on that as well. I want to thank Brian Thompson, who donated the tent and the table and coordinated our electioneers for all 3 voting centers, and will be coordinating for the 25 polling places on Election Day. I see several of the commissioners are volunteered. That's wonderful. I hope you all can get out there. We do need more poll watchers. Election Day, we have like 26 some polls. I've been doing electioneering, and then I switched over to poll watching to open the poll in the morning and close it at night. We also need more canvassers. Canvassers count the votes. So we're going to have Tuesday on Election Day at 2 o'clock. There'll be 1 canvass. It'll be short. The big mail-in ballot canvass is Thursday at 10 a.m. So text me, anybody who's interested, 301-575-4889. I'll get you to the right person, get you plugged in. You can go to our website at ccgop.net. We had a total of 4,984 and counting early voters. I did want to just mention our Kristen Zimmer and Greg Malvo, Board of Education, and my top priority, of course, is to vote against the constitutional amendment. That's the Reproductive Freedom Amendment, which says every person, and does not include an age, which includes children. It's not limited to abortion. It's going to expand transgender rights without parental consent, and taxpayers will bear the burden. It's very deceptive, too broad, and we have a lot of, from Carroll County Right to Life are out there. We have a lot of the brochures going out. So I think we'll do okay in Carroll County, but we'll be counting on our Board of Education members to stand up to the state if that goes through. Wish you a happy Halloween. Don't be scared to vote. Thank you.
Thank you. And that was our only caller?
That is correct.
Okay. Administrative session open.
I have just one thing, if I may. It's Christy.
I thought you said you were taking off your costume.
Oh, my goodness. You weren't amused with it this morning, so I did take it off. So
I was amused.
Yeah.
You lost your halo?
I did. I know it's hard to believe, but I just want to send a thank you out to the departments that participated in the Carroll County Government Employment Expo, our fall expo.
All departments.
It was all departments, as well as the Sheriff's Department. So we had approximately 130 to 135 participants last night, which was up about 30 from the expo that we did in the spring. So we continue to get the word out there. A lot of engagement with the departments and the individuals that showed up for the expo. We had a pretty steady line from about 5 o'clock until 7:15, which was great. And as you're familiar with our application center, people go on there and register, and then they also can fill out applications for our jobs. Between the two of them, yesterday alone, we had 104 people sign up for that. So that really is a great number of individuals that are interested in employment here. So one of the big things when we put out there is, come learn why
Other employees love to work here at Carroll County Government. So someone asked me last night, and oh gosh, there I am playing Plinko. Someone asked me last night, and I said most is because we have a lot of fun here. There's a lot of collaboration. We all like to work together, and it is a team atmosphere. So we definitely demonstrated that last night. So I just have two things for you. The first one is our giveaway last night, which is mystery fruit roll-ups that say our careers are out of this world, with our aliens on it. And then I also have a sticker if you would like to wear, which also says our employees are out of this world. So I'll give you a little bit of a Halloween costume and a little treat because I know we are after lunch. So thank you again for allowing us to do this. I want to apologize for the fire alarm this morning. One fun thing we do is have the kids here for trick or treat. We were all downstairs. They were going through. Our departments do a great job setting up the tables, all kinds of decorations. Brian Bokey was actually out of costume as well. He plays an excellent minion. I will make sure that you see that picture because him and some of the members in engineering just looked awesome. But I think one of the kids bumped into the fire alarm, so I apologize for that.
The kid
But
bumped into the fire alarm, or he bumped
I
into
can't
the
say. Several of them were dressed up as firemen, so I don't know if they thought it'd be really cool to see how this works, but we did escort them all out, and I do apologize, and I hope that doesn't influence us doing it again next year, because we
Not
all
at
really
all.
do like it, but I thought it couldn't be worse time for this, so, but it was really, really great this morning as well. So Carroll County government employees work hard, very, very hard, but we also have fun too, so I'll hand you your snack.
Thank you for the upbeat
Yes.
report, and it's,
I can pass them around.
Fruit roll-up?
Those kids were banned from the building from now on, right?
I think we're getting a happy building here.
There you go.
Thank you.
Right.
There we go, you got it.
Uh-huh, thank you. Oh, we each get one? Oh,
Does he really
man.
deserve one?
Oh,
Does-
and
does-
wait,
does-
when you eat them,
Thank you.
there's tattoos that go on your tongue, so. That's an added bonus.
Oops, I'm sorry.
What?
Oh, my.
All right, thank you guys.
Thank
Happy
you.
Halloween.
How was
Thank
that
Happy
possible?
Halloween.
Thank
Thank
you.
you.
Thank you.
Thank you very much. Congratulations on last night.
Yeah.
Any commissioners have anything who are open?
Nope.
Edmund?
No, sir.
Commissioner Rothstein, you hesitate. Is it nothing?
No,
Okay.
no.
And,
No, go ahead.
so agenda review, right? We're ready.
Yes, sir.
Good afternoon.
Good afternoon, Wanda. How are you?
Good afternoon.
Cell phone, forgot the cell phone.
Do you want to talk to us again?
Yeah, you would love to hear me.
Okay, next week, Monday and Tuesday, November 4th and 5th, show no activities. Wednesday, drug treatment court graduation, Commissioners Gordon, Kyler, and Rothstein. And planning and zoning, Commissioner Gordon. On Thursday, 8 a.m., closed admin, 9 a.m., open session. There are some priority carol with National Youth Homelessness Awareness Month proclamation. Next item would be amendments to Carroll County Code of Public Law, local laws and ordinance. The next item, investigate and analyze present status of UPS generator and distribution switchgear. Next item, Town of Mount Airy, Carroll County Program Open Space. Next item, Cisco Food Services. Next item, Agriculture Pres Program Update. Public comment. Agenda review, admin session open. At 6 p.m. is the Carroll County Land Trust Annual Meeting and Dinner, Commissioners Gordon and Kyler. 7 p.m. is Rec and Parks Volunteer of the Year Awards, Commissioner Rothstein. And both of those are good activities. I'm glad we were able to cover them. It's one of those days where you want to be at both of them. Friday, Century High School Veterans Day Chat, Commissioner Rothstein. Saturday, no activity. Sunday, Commissioner Vigliotti does the podcast. 4 p.m., Sykesville Veterans Remembrance Day, Commissioner Rothstein. Look good. On the next week, Monday, November 11th, county office is closed for Veterans Day. Transit Advisory Council at 3 PM won't happen, right?
No, I wouldn't think, since we're closed.
And I forget, I think I've seen the date. Is it Wednesday? I'm not sure. It's, I'll get you the
It won't be
date. I
Monday.
saw an agenda and a date on it, but cross that one out there.
And I'm sorry, Wanda, I'll be at the American Legion in Tawnytown on Veterans Day on the 11th.
And I tend to think there's a bunch of activities going on that some of us may be at that day. On Tuesday, Carroll Community College Board Annual Outreach Breakfast, Commissioners Kyler and Rothstein. Ag Center at 7 PM. The board meeting with Commissioner Kyler. On Wednesday, November 13th, Bridging Life Annual Veterans Breakfast, Commissioners Gordon and Rothstein. Farm Museum Board Meeting, Commissioner Vigliotti. 10 a.m. Small Business Association visit to Carroll County, Hampstead Eldersburg, Commissioner Kyler.
And I'll be, I apologize, in the afternoon. I'm going to be at a few of those as well, so you just put me down there as well, because I'll be in Eldersburg.
And 5:30 is PSEG public meeting. And should she get the solar hearings
we'll put it on there.
dates to put them on also?
Yes.
Yeah, there's one of the, I think 7 PM. It's one of those that evening. I don't know if we know the time yet or not.
The 12th also.
On Thursday, closed admin.
I apologize. PSE&G, I think we said we're all going, or, I mean, I plan attending PSE&G. No?
I mean, are we,
It's a,
I don't know if I'm actually going or not. We don't actually have a role, am I correct?
no,
Yeah.
I don't believe so.
What's that?
I don't believe we have a role in that. I think it's.
No,
their
no,
job.
no, no,
I
no.
just
I mean,
plan
not an
on
official one, at
attending,
least.
so,
I mean,
Yeah,
Not that I'm aware of.
yeah, I don't think so.
Find out differently, we'll let you know.
Yeah, and you never know, right?
Yeah.
Yep, and I think we need to verify if that's a town hall or an information meeting
Right.
and even put that on here so people know, or on our,
On our calendar.
Our calendars, yeah.
on that page.
Do we know if PJM might actually be in attendance?
I don't think so.
I
thought
doubt
was
it,
just
but-
PSE&G.
Okay, thank you.
Wanda, you can add me to that as well on the 13th.
And me too.
And that reminds me, I don't think we've mentioned that in public. There was a letter to PJM from 5 governors, one of which was Governor Moore of Maryland.
Okay, but that's,
And it was signed October 25th. You know, just PJM get us into the conversations of, you know, dealing with the grid. So that's kind of what the gist of the letter was. So how it affects this, I don't think it does.
Yeah,
but
yeah, I think it's
just-
too late for this, probably. But it can't hurt.
No.
Thursday, 8 AM, closed admin, 9 AM, open session, Priority Carroll, solar energy generating systems ordinances, public hearing for that. The next item is a public hearing for Chapter 158 housing ordinances. And the next item is comment letter for Westminster Annex. 80, Maryland Home Builders. Public comment, agenda review, Friday, Saturday show nothing, and Commissioner Kyler gets to do the podcast.
Wanda, I've got one other thing. For the week prior on Saturday the 9th at 10 a.m., I'll be at the Westminster Veterans Day Parade.
Okay. Yeah, they're probably, that's good to note. There are probably also several other Veterans Day kinds of things that we'll be adding as.
Anything else, changes, adds, whatever? We need a motion to adjourn the open session and go into closed.
So moved.
For
Second.
land acquisition.
So moved.
Second.
Any discussion? All those in favor?
Aye.
Opposed? Thank you.
Thanks, Wanda.